All right. Good afternoon. Welcome to Health Coverage Insurance and Financial Services. Today we have one public hearing and some work sessions, and we'll start with introductions with Senator Bailey.
I am Senator Donna Bailey. I represent Senate District 31, Buxton, Old Orchard Beach, and Saco, and I serve as the Senate co-chair.
And Representative Mastracchio.
Good afternoon. I'm Anne Marie Mastracchio. I represent House District 142, which is part of the city of Sanford and the village of Springvale.
Good afternoon, everybody. Representative Paul Flynn. I represent House District 63, Winslow, Albion, Freedom, and Unity Plantation.
Good afternoon. I'm Rolf Olson, District 86, which is Raymond, Casco, Fry Island, and a bit of Poland.
Good afternoon. My name is Bob Foley. I represent House District 145, which is most of the town of Wells.
Representative Arford.
Good afternoon, everybody. I am Representative Poppy Arford, and I represent State House District 101, the western part of Brunswick.
Hello, Representative Michelle Boyer. I represent House District 123, which is most of Cape Elizabeth.
Good afternoon. I'm Sally Clucci. I represent House District 52, which includes the communities of Bowdoin, Bowdenham, and Richmond.
And I'm Christy Matheson. I represent District 151 in Kittery, and I serve as the House co-chair. We have a sponsor for our bill today, an act to strengthen the healthcare system in Maine, presented by Senator Bailey.
All right, thank you. Good afternoon, everyone. Representative Matheson, fellow colleagues on Health Coverage Insurance and Financial Services Committee. As you know, I'm State Senator Donna Bailey, represent Senate District 31, and today I am pleased to introduce my bill LD 378. As amended, LD 378 proposes a technical amendment to LD 1906, a bill that you may remember we enacted last year to ensure that Maine employers are able to obtain meaningful audit rights in their contracts with third-party administrators and pharmacy benefit managers. The law also prohibits TPAs and PBMs from including restrictive audit provisions in contracts with employers. As we heard during committee consideration of LD 1906, audits are a critical tool for Maine employers to effectively monitor the millions of dollars they spend annually on healthcare coverage and to reduce erroneous payments that come out of the pockets, not just of Maine businesses, but also their employees and families. In fact, they have a fiduciary duty to ensure plan dollars are spent prudently. Unfortunately, as it has come to my attention that employers attempting to exercise these new audit rights have encountered a technical issue related to the definition of administrator in Maine statute. Under current law, certain TPAs that are licensed by the Bureau of Insurance as insurance companies consider themselves exempt from that definition and therefore from the requirements of LD 1906. Because many self-insured employers in Maine work with TPAs that are also licensed insurers, this interpretation has effectively prevented those employers from accessing the audit rights the legislature intended to provide. LD 368 addresses this issue by clarifying that for purposes of the audit provisions established in LD 1906, the term administrator includes any entity that, on behalf of a plan sponsor, collects charges or premiums or adjusts or settles health benefit claims for Maine residents, notwithstanding the statute that exempts TPAs that are licensed by the BOA from the definition of administrator. This clarification applies only in the context of audit requirements established by LD 1906. The bill also clarifies the definition of a plan sponsor, specifying that only fully insured plan sponsors are not covered by the law. I appreciate the committee's willingness to consider this technical correction. I think it was the intention of the committee, and many employers are currently negotiating or renewing contracts with their TPAs and PBMs and had planned to include these audit rights following enactment of LD 1906. Thus, you will see that the bill has an emergency preamble. I've kept my remarks brief today as others testifying after me will provide additional information on both of these issues and the broader importance of the audit rights established by LD 1906. I thank the committee for its time, and I'd be happy to answer any questions if I can.
Thank you. Questions for the sponsor? Seeing none, thank you for your testimony. Is there anybody in the room that would like to testify in favor of this bill?
I'm not sure what I'll be listening to.
Thank you.
I'm going to do my best.
Let's go right ahead. Thank you.
Great. Senator Bailey, Representative Matheson, members of the committee. My name is Trevor Putnaki. I'm the CEO of the Healthcare Purchaser Alliance of Maine. I'm here to testify in strong support for LD 378. As Senator Bailey mentioned, this bill is really a technical correction to LD 1906, which the committee unanimously passed last year. We're really here to ensure that the audit rights that you all intended to create actually reach Maine employers. So as Senator Bailey noted, as our members and employers around the state sought to actually exercise the audit rights outlined in LD 1906, they encountered pushback from carriers who essentially argued that the bill doesn't apply to them because they're licensed as carriers, not plan administrators, which is sort of like a technical detail that I am sorry for missing initially. I really do feel bad about having to come back and fix this. I think it's really just about making sure, again, that these rights are actually achievable for employers around the state. It has to do with statute 1901, which exempts TPAs that are also licensed as insurance carriers. Effectively, like I said, no employers using these large TPAs in our state have been able to access the protections the committee passed last year. It also clarifies that for the purpose of these audit rights, the administrator includes anyone settling claims on behalf of these plan sponsors, regardless of their other licenses. As Senator Bailey noted, it applies very narrowly to LD 1906. We don't believe there's any unintended other targets of this language being inserted. And just to remind folks sort of why we pursued this in the first place, billing errors are common. Claims billing is extremely complex. And for the claims that our members have been able to audit, some of our members get access to audit, say 200 claims on tens or hundreds of thousands of claims. They do find errors in those audits. The Municipal Trust was up here testifying that when they audited 200 claims, that they were allowed by contract to audit, they found a 33% error rate. I've heard error rates even higher than that. Billing advocates estimate it's about 2 to 4% of total spend is paid out in error. And that spend directly contributes to higher premiums for the employer and higher costs for plan members. So frankly, I think this is like an easy fix to help bring down the cost of healthcare. And also, it's really important to plan sponsors who have a fiduciary duty to prudently manage their plan assets to be able to make sure that the people they're hiring to make those payments are making them correctly on their behalf. I mean, this feels very much like a common sense issue to me that, frankly, I don't see a reason why someone who's paying their own medical bills shouldn't be allowed to determine that those are being paid correctly by the vendor they hire. But that's exactly the situation that we found ourselves in. So, I mean, that's pretty much it. I can keep it pretty short here. I really appreciate the committee hearing this. I do think the emergency designation is important because we have members and employers around the state are negotiating these contracts right now, and they're getting this pushback right now. They really don't want to enter into a 2-3 year contract that includes these restrictive auditing terms, especially with the cost of healthcare continuing to grow and put comprehensive coverage out of reach for too many Mainers. So I really appreciate Senator Bailey introducing this bill. It means a lot to us, and I would appreciate this support. So thank you very much. I'm happy to answer any questions.
Thank you. Questions from committee members? Representative Arford?
Thank you, Madam Chair. And really, I want to thank you so much for bringing this bill to us. It makes a great deal of sense, and I agree that it could, if passed into law, could result in significant savings. However, this is my question to you. You said there's a 33% error rate. I'm assuming it goes both ways, even though predominantly the errors may be overpayment, there could also be underpayment. Do you know, or were you not talking about underpayment? Was that 33% just overpayment of claims?
I believe it was- I
or
believe it was
just-
just overpayment. I mean, I guess technically it could go both ways, but I think either way, it's really about making sure that
Right,
the claims are being paid correctly, right?
Right.
If there's an underpayment, then that should be corrected as well. In my experience in talking with employers, it feels like it very rarely goes towards underpayments, almost always towards overpayments. But I will concede that that is a possibility. I mean, again, claims processing is an extremely complex issue, and mistakes are common. And the 33% I would just note was for one plan sponsor.
Okay.
I don't know that there is a accepted like average error rate amongst claims payments. I haven't been able to find anything other than that statistic about errors accounting for about 2 to 4% of total spend.
So my follow-up question would just be, does this, or is there already a law in place that would allow for clawbacking of the overpayments? Once they are, like, say, an entity like yours does the audit, discovers significant overpayments. At that point, is there an entity to report it to that would do some clawing back of these payments? How would that work?
There are ways to claw back. I mean, oftentimes carriers, if they overpay on a claim or withhold some amount of money from a future claim to offset and basically get to neutral with them. For really large claims, sometimes these auditing vendors will negotiate directly with the provider to recoup dollars. So it's a little bit different. I will say most contracts with carriers include performance guarantees around accuracy of claims payments. So those would be at stake. I mean, right now it's pretty hard to determine whether carriers are actually meeting their performance guarantees when you can't audit like how well they accurately pay claims. So there are some mechanisms to get that money back. I will say they're not always successful, but I think something is better than nothing. And again, these plan sponsors have a fiduciary duty to ensure that they're really prudently managing these plan assets. So basically throwing your hands up, even if you're not able to recoup dollars, you have to show that you tried to recoup them and that you're actively managing that.
And thank you again for this bill.
Thank you, really.
Representative Foley?
Thank you, Madam Chair. Thank you, Trevor. Trevor, why can't the companies put in audit requirements in their contracts? If
They
have-
try. Yeah, absolutely. I mean, every one of our self-insured members has tried to get these audit rights. Even the largest plans in the main, we're talking tens of thousands of lives, just get a flat no. We're not going to let you do this. They argue it's industry practice to restrict auditing to a very small subset of claims. And it's just an area where they have been unwilling to move on. And I think you'll see I attached testimony from proponents of 1906 to my testimony. And you'll see from one broker consultant in there that works with large clients all around the country, he's encountered this for even the biggest employers that he works with. I mean, it's uniform. It's this industry practice that nobody on the plan sponsor side likes, but nobody has been able to solve for, which is exactly why our board asked us to pursue this issue last year and try to get a statutory fix.
Additional questions? Seeing none, thank you for your testimony.
Thank you very much.
Is there anybody else in the room that'd like to testify in favor of this bill? Do we have anybody online? Is there anybody in the room that'd like to testify in opposition to this bill?
Always pleased when I don't have to testify against the chair's bill when she's in the room. So things work out for me again.
She's right back
I
there.
know, I'm going to be quiet. Representative Matheson, members of the committee. My name is Dan Demerit. I'm the executive director of the Maine Association of Health Plans, testifying in opposition to LD 378. I'll tell you, we spend, better part of 2 years watching these concept bills and wondering what they could and will be. And with a title like An Act to Strengthen the Healthcare System in Maine, it comes back being this bill. So it's an interesting, just glass half full, glass half empty, I suppose. MEAP understands the need to update Maine statutes to accurately comply with the intended purpose of the legislature. Nevertheless, the need for clarifying legislation so soon after the enactment of Public Law 2025, Chapter 487, LD 1906 from last year, suggests not enough was done to understand and work through the differences among the stakeholders. We see with bills in front of this committee on scope of practice and other issues, a great deal of time is spent going back and forth to try and work out issues, and it's probably too soon to bring up the chiropractors and the veterinarians, but a lot of work and a lot of time goes into that. That same opportunity wasn't afforded with this bill last year from the health plan perspective. And we oppose LD 378 because the statute it seeks to update is still unnecessary and remains unworkable, even if amended by this legislation. We urge the committee to use the sponsor's amendment to LD 378 as an opportunity to delay the effective date of the public law and to January 1st, 2028 or later, and to direct the stakeholders to work together to achieve a compromise that can be reported back to HCIFS at the start of the 133rd legislature. The underlying bill, the new statute, it was unnegotiated and nearly unlimited audit rights for plan sponsors. Our plans report that their contracts already include audit provisions that ensure orderly access to information and health claim transparency for sponsors. These provisions are extremely complex and have the potential to add significant costs to the administration of health coverage, care coverage in Maine. And policymakers should leave these negotiations to the private parties involved in the contracts, not step in at the request of one side or the other. Public Law 2025, Chapter 487, significantly and unnecessarily expanded plan sponsors' rights and access to claims. Our subject matter experts identified a number of challenges in terms of implementation with the new law, and I bullet them out in my testimony for your consideration. The number of claims that can come through, the definitions that haven't been determined, access to high cost claims, whether a claim is billed or paid. These are all questions that our plans are going to continue to have as this bill takes effect. And we urge the committee to take this opportunity for a bill that needed more work before it was passed initially, to bring the parties together, delay the effective date, and let us come back to you this committee next January with a proposal that is a true compromise and could be implemented effectively by the parties. So with that, I would be happy to take any questions, and thank you for your time.
Thank you, Dan. Questions from committee members? Seeing none, thank you for your book. Yeah, Representative Marford.
Thank you, Madam Chair. I just have one quick question. The comment you made about there might be significant costs. Do you have any sourcing for the significant for that? Do you have any source documents or information you?
Yeah, no, we haven't done a pro forma financial statement on what the costs will be, but you think about it in terms of the size and scale of these requests, and they're not typical they're not typical to the day-to-day operations of the plans today. So they can be with the deadlines. They could pull people off other projects and existing work, and require new FTEs to comply with what is a largely unique to Maine requirement that plan sponsors have this unfettered access to claims data that they just don't get in other states. And they're certainly plan sponsors are certainly free to come and work and negotiate with the plans and request access. They don't get it because of the cost. And so they've come to the legislature and as a workaround.
If you do have any data to substantiate that, I appreciate that it's your learned opinion, if it is at this point, and I respect that. I'm not questioning that, but I would like to see any actual data you have on that.
Okay.
Thank you.
Thanks.
Additional questions? Seeing none, thank you for your testimony.
Thank you. I appreciate it.
Welcome.
She left.
She threw up her hands.
Yeah, she saw me coming. I'm out of here. Representative Matheson, members of the committee, my name is Charlie Sultan. I am here on behalf of Cigna Healthcare in strong opposition to this bill. We negotiated, as you may remember, very strongly on this bill with Mr. Putnaki when 1906 was passed. We knew what was in the bill, and I'm sorry that he may not have. There was a lot of concern then that this would create a lot of cost. And I want to go through this almost line by line with you if I have enough time. to show you where those costs are borne in this bill, and that really don't generate real savings, or that would outbalance the costs. So if you go to section 1, number 1, the language says must include any itemized billing statements and medical records. To answer Representative Arford's question, this requires manual work that is not otherwise done. So you have to pull people away to do this kind of manual pulling of records and collation of potentially all the records. And so it's a huge cost and time effort that is not necessary in order to get a clear picture of what a statistical analysis might give you anyway. Also in section 1, in the first paragraph, there's, and I don't have the line numbers, but it talks about the high cost claims. Here, the question for you, committee, is this the amount billed or paid? We don't know what this term means. So do you mean billed or paid? Because that's very different. It's ambiguous at best. Also in section 1, so the turnaround times we believe are unreasonable given the manual labor that is involved in these processes. Would a business know to request an audit within 2 business days? What about private or patient privacy? And could a health plan respond appropriately within 30 business days without diverting time of our employees from their normal course of business, responding to all the other responsibilities that they have? If we go down to section 2 under section 1, claims data, the right to audit, these are specified in ASO contracts currently, and those are administrative services only contracts by that term. So this bill runs afoul of the terms that are already in our contracts with our insureds. Also in section 2, all claims paid would require electronic analysis, which has a false positive rate of 85 to 95%, shifting the burden back to Cigna to try and verify what exactly is happening in that audit. And then also in section 2, at least once in a calendar year. Now, despite what Mr. Petnaki said to you, we offer this once a year to our employers that have more than 5,000 employees. And for those with less, we offer it every other year. So I don't know why he said that people don't. We do. And that's just a direct counter. I have a series of other problems with the bill that create cost without benefit. As Mr. Demerit said, this interferes with our agreements with our employers already. These are sophisticated employers, and we think you should not interfere in that relationship. Thank you very much.
Thank you, Mr. Sullivan. Questions from committee members? Seeing
you.
none, thank you for your testimony. Are there additional people who'd like to testify in opposition?
I'm going to stall because I need a minute to catch my breath. Good afternoon, Senator Bailey, Representative Matheson, and members of the Health Coverage Insurance and Financial Services Committee. My name is Christine Ossenfort, and I am the Director of Government Relations for Anthem Blue Cross and Blue Shield. And I appear before you this afternoon to testify in opposition to the proposed amendment to LD 378. This is obviously a policy decision for the legislature. You did pass LD 1906 last year, and whether you want to include carriers or not. But I do think that, as Mr. Demerit and Mr. Sultan have noted, there are some issues with that underlying legislation. So this does present you with an opportunity to address some of those issues. I would also note that our contracts do generally provide audit rights. And I'm not aware that any plan sponsor has approached us about audit rights since LD 1906 took effect. We did receive an inquiry from one broker, just a general inquiry about how the legislation was going to be implemented. But I'm not aware that any plan sponsors have attempted to negotiate audit rights or been turned down. We do believe that there should be reasonable limits on the number of claims subject to audit if this legislation is to move forward, or even under the existing legislation that was enacted last year. All claims is excessive, and as others have noted, it is extremely burdensome to produce all claims. It really should be a statistically relevant sampling of the claims rather than all claims. We expressed concern last year with respect to some of the provisions in the legislation, and I apologize I didn't get a chance to reduce that to writing, but I do have my letters from last year to you. If you want those concerns, I can easily recreate it. But some of the concerns dealt with the language around non-disclosure and data use agreements. There is language in the legislation. We're not sure it is sufficient to protect the data and the personal information of those whose claims might be provided. We also had concerns with respect to the liability for disclosure of information and suggested language to you last year that I can certainly provide to the committee. The existing legislation limits liability to the limits of liability in the contract between the administrator and the plan sponsor, but it doesn't address liability to third parties whose information might be inadvertently released or disclosed by the plan sponsor's auditing vendor. So we do think that there are some gaps that if you are interested in this legislation, it does provide an opportunity to address those gaps. You could delay the effective date of the existing legislation, which just took effect on 1/1 of this year, and try to address some of those concerns and have a better piece of legislation. So with that, I'd be happy to answer any questions that you might have. And of course, we'll be present at your work session as well.
Thank you, Ms. Osborne. Is there anybody here that has questions? Representative Barford?
Thank you, Madam Chair. So can you just tell us a little bit more about the risk to the entity that the data is their data, if it was to be shared in the way that this is requesting it be shared for auditing purposes with the plan sponsor? And I have a little bit of understanding of the nature of the de-identified data, and I'm assuming it would be sent over as de-identified data. So if you could just, I'm not quite understanding the risk there.
So I don't think it has to be de-identified. I'm trying to look back at the language. There are some restrictions about certifying compliance with HIPAA and that they have complied with HIPAA and HITECH, but I'm not sure that it requires that it be redacted. I'll have to take a closer look at that and get back to you. But we're concerned about our liability in the event that a vendor discloses information that we transferred to them. Under the Maine Insurance Data Security Act, we may have liability. If someone's going to go after, the largest entity, that's likely to be us, not the vendor. So we are concerned about making sure that if they want access to this data, that they also have liability associated with the release of that data once it's in their hands.
Thank you.
Additional questions? Seeing none, thank you for your
Thank you.
testimony. Is there anybody else in the room who'd like to testify in opposition to this bill? We don't have anybody online. Is there anybody who would like to testify neither for nor against this bill? Seeing none, does the committee have any questions or requests from Colleen for the work session? No?
This may not. Thank you, Madam Chair. It may not be possible to secure this data if in fact we're one of the first states to do this actual thing. But I am really interested in this. If we could source information on any of these thoughts have been shared around, that passing this particular bill would open the carriers up to, they're very concerned about the data being compromised in the transfer process or in the utilization process for the audits. And I'd be very interested in if there's experience in other states, as if anybody else is doing this, what's been their experience? And I know that may be really hard to come by. So, but if it's available, I'd love to see it.
Thank you. Any additional requests? Seeing none, we'll close this public hearing.
Thank you very much. And we will open the work sessions once Edna and Colleen have a chance to rearrange the furniture.
No, just figuring out which way to go. We were gonna start with Lori's, but if she's not here, we might want to start with 208.
Are you texting her?
I just did.
I know, it's crazy, so silly. Okay. What order would you like? Did you say which one?
We haven't, because we're just seeing if the bill sponsor is on her way. I think we're waiting to hear.
2162 perhaps?
Correct.
I'll have Ed hand that out. We can pivot if we need to.
Okay. Yeah, because there was an amendment. Yeah.
Start.
She's on her way.
She is on her way, so we'll just wait briefly.
228.
Representative Gremlick is here, so go ahead, Colleen.
So this is another work session on LD 2162. Edna distributed on the pink sheet of paper a revised amendment that was distributed to the committee and interested parties previously at Representative Gramlich's request. And I can just go over the changes that have been made in the revised sponsors amendment. I think as I noted in the email that was sent out with the original draft, it's my understanding that the sponsor is seeking to, this would strike and replace the original bill, but is seeking to focus on the substantive provisions in the original legislation that were related to minors. As this has been redrafted, it would prohibit deployers, which is the defined term for those entities that operate or distribute artificial intelligent chatbots or social artificial intelligence companions. It would prohibit deployers from making chatbots with human-like features or social intelligence companions available to minors to use, interact with, purchase, or converse with. It also would require deployers to implement and maintain systems to detect, promptly respond to, report, and mitigate situations in which a minor indicates to a chatbot that the minor intends to harm the minor or commit harm to another person. It removes language in the original bill and in prior versions of the sponsors amendment that included requirements for age verification systems, for specific data collection and security language, and also removes language that was related to therapy chatbots. With regard to the age verification language, that was based on a recommendation from a review from the Attorney General's office, that they did not believe that language was necessary, and just having a substantive prohibition on the use of these chatbots with artificial intelligence, these artificial intelligence chatbots with human-like features was sufficient, and they would have some ability to use the prohibition if there were any need for them to enforce the legislation, they'd have enough information to make those determinations about whether or not these chatbots were being made available to minors, given the other language in the legislation. With regard to the data collection and security language, my understanding is, I think there's a thought to defer. The legislature is considering comprehensive data privacy legislation. And it was felt that it was best to just focus the legislation on this. The sponsor can correct me if necessary. And then finally, I believe there was the language related to therapy chatbots that was removed. I think there was some understanding that the committee's legislation, LD 2082, that Representative Kuhn sponsored, addressed the use of therapy, artificial intelligence in therapy or psychotherapy services. The last change that I would note for the committee is a change in the penalties and enforcement provision. Under the all of the prior versions, there was language giving minors who use a chatbot that does not comply with the terms of the chapter, or a parent or guardian acting on their behalf, to bring a civil action against a deployer independently or as part of a class action to recover damages. There were some statutory damages that were in prior versions of the legislation, or actual damages, whichever is greater. So it would allow the recovery of those. This proposal increases the amount of that statutory damages. It proposes to increase the damages in an amount not to exceed $2,500 per incident, up to a maximum of $50,000 per minor, or actual damages, whichever is greater. And I think just to explain, I think the thinking is the maximum of per minor was to address in any event if there was a class action, for instance, it would act in a way to minimize the potential statutory damages if they were seeking to recover those, as opposed to actual damages. So it wouldn't prohibit someone from seeking actual damages, but it sets forth that limit. I guess I would say in terms of how the penalties or the damages amounts were arrived upon, there are some analogous provisions in statute that I shared with the sponsor that give individuals an ability to bring or recover monetary amounts, individuals in a civil action. Two that were looked at and reviewed is, one, there are provisions when there is a security breach of someone's personal data in the Notice of Risk to Personal Data Act, and some of those monetary penalties, and then also reviewed provisions in statute that give individuals the right to bring a civil action if their personal health information is intentionally shared. And that has a maximum penalty of $50,000 for health facilities that would be sharing that information. You know, there weren't really many analogous statutes that provide specific statutory damages. Of course, I think everybody's aware there are some statutory damages under the Maine Tort Claims Act and wrongful death, but it was hard to find ones for individual actions. And so that's just some background as to how that was arrived upon. But it's, of course, the amount will be a policy decision for the committee. And I'll stop there, and I'm happy to answer questions. And I know the sponsor is here as well.
Great, thank you. Representative Mastraki.
Thank you, Madam Chair. So Colleen, does this mean that, so we heard testimony about adolescents committing suicide. So does that mean that if I couldn't get the Attorney General to bring a case against them, that I could only go for a civil suit, and the maximum that I could collect would be $50,000? No, that would be $2,500.
So
I'm
this, it's two things. It's an either or. It's
50,000.
It's the statutory damages or actual damages, whichever is greater. So you would be able to seek higher amounts of damages, but if someone just wanted to seek that
quantifying-
lower rate, that what they could.
Okay, I just want to make sure the ability.
It's
is
not
there to-
limited to just those statutory damage
Okay.
amounts that I mentioned.
Representative Olson.
Thank you, Madam Chair. In the last meeting, I'd asked whether, we know that 15 other states are looking at this. And some, I believe, may have already enacted none. So were we able to get any data on what they were doing and kind of cross-check it to what we're asking here to see if there's commonalities?
So, to my knowledge, no other state has enacted something based on this particular language, that has been presented, and it is modeled in part on a model legislation that was developed by a nonprofit organization. So there isn't really any data about how it has worked or what has happened, unfortunately, because it is a new proposal that legislatures are considering. There have been some efforts to amend the legislation, but it's really just hard to say, and states are varying as to what they're doing, and they're still in committees and still in those processes. So I didn't have anything really definitive to give to the committee, like this is what someone has enacted yet. Hasn't gone that far.
Representative Flynn.
Thank you, Madam Chair. Colleen, on number 2, on page 2, I'm looking at the original amendment and the last sentence has been dropped. Why did we drop it?
And where are you looking? Number 2 on
On
page
page 2 on the top of the pink sheet,
Yep.
if you look at the yellow sheet on 2, the last sentence, the deployer shall implement reasonable age verification. That's been dropped entirely.
It has been. That language was taken out of the proposal. I believe based on the recommendation and discussions with the Attorney General's office that has reviewed it, and suggested that the language prohibiting making these available to minors was sufficient for them to enforce the legislation, and did not feel that having a additional requirement that they have age verification systems to ensure that they're not accessible to minors was necessary, because the language just says you can't make them accessible to minors, period, by taking that sentence.
Right, but the other question we had in the public hearing, I'd asked for work session material is, what are they using to determine what is age
Yeah,
appropriate?
and that
We
was
don't know.
that was part of the issue.
Right.
But there are a range of, as I understand in my discussions with them, a range of systems that are out there. And it would be difficult to enforce and determine which ones were reasonable. And if the legislature chose to move forward with this legislation, it would be a policy decision. And if the legislature enacted the bill, with that language in or without, the first sentence is the substantive prohibition that you cannot make a chatbot with human-like features available to a minor. And that is the language that would be focused on. And whether or not someone had an age verification system, the reason why they would have the age verification system would be able to ensure that they weren't doing it, but there wasn't a need to have that additional language. I'm not sure about explaining it right, but
I think so.
it's a yes or no question, and
But the oversight on all of these deployers is the Attorney General's office, correct?
the way that this bill is drafted, yep, it would give the enforcement authority to the Attorney General's office, and then as I mentioned, we were just talking about prior, there's also a provision that would allow an individual private right of action. So there would be an ability for an individual, a minor, or someone, a parent on their behalf to bring an action if they felt that the Attorney General's office for some reason wasn't enforcing it. They would have the ability to bring private right of action.
But you
too.
are, Representative Flynn, you are correct. It's going to be overseen by the Attorney General's office, and the Attorney General's office is even authorized to adopt rules. So certainly as part of those rules, they may have something about age verification and those types of things, but it's not going to be a statute.
Yes, and there was also, there's some things in the definition, if you look, there's a definition of human-like features. And there are some elements in there that may also, lend to some rulemaking about some, their interpretation of what those terms mean and how they would focus on those terms to investigate whether or not a violation has occurred.
But I'm having a hard time understanding this, but the Attorney General's office is saying that they don't want to see what their age verification systems are.
No, I don't think that's what they're saying. I think what, my understanding of what they've said is that the language in the statute says they shall implement reasonable age verification systems to ensure that chatbots are not accessible to minors. The first sentence says they should not be accessible to minors, period. So it was just a reading of the statute that they can use age verification systems to make sure that they're not making these available to minors, but saying it in statute didn't appear to be necessary to them.
It's redundant.
Well, to them. Okay, thank you.
Representative Olson.
Thank you, Madam Chair. I guess, in regard to the rules, where this is, this is new legislation. It's new legislation in a lot of different states and whatnot. Should we not have that as major substantial rules in the initial go around rather than just routine technical? Because that'll give the chance to really relook at the whole thing and make sure that it's doing what we want it to do.
You could certainly do that. The way this is drafted, it's an authorization to the Attorney General's office to adopt rules, so it's not a requirement. So typically, when the committee, if you made the major substantive, that would be fine. But if the legislation went forward with a may adopt rules, and if any rules were ever adopted, they were major substantive, you'd be seeing those major substantive rules, who knows when? Because they would
If
have
at
the
all.
discretion, right? They would have the discretion to do it. In my experience, when the committee has designated things as major substantive, it's when you've definitely wanted somebody to adopt rules. So I think if you wanted to do that, you might think about changing the language of this to say from may to shall. That's just your policy decision.
I just think where you're breaking new ground, it really it gives you that opportunity to come back and say, oops, we missed something. We need to look at that and figure out where we want to go there. So.
Yeah, the other thing I guess too is if you're thinking about doing that, to think about where do you want them to adopt rules? Like what areas of the legislation would need to adopt rules? Because often too, the committee will say, we want rules adopted about, scope of practice or credentialing standards, or you specify what you want the rules to be, or, the practice standards for nurse practitioners, for instance, or formularies for naturopaths. You specify what the subject of the rule would be in the major substantive designation, and this doesn't specifically identify that. So you might think about which areas of the substantive provision of the bill, which is the prohibition on making these available to minors, what additional things should be the subject of the rulemaking, or if it's just implementing as the authority to implement it as necessary would just be to the discretion of the Attorney General to determine when they thought rules would be needed. But if the committee wants rules to be adopted, it would be helpful to guide them as to the subject matter of the rulemaking. Something to think about.
Further questions, so just make sure we understand the amendment. Representative Arford.
Thank you, Madam Chair. Just quick question. Again, I brought this up in our original conversation when we used the phrase reside. It's minors who reside in the state on page 2 at the very end of the page, number 2, you define minors. Did we determine whether or not what the different, if reside would encompass any minor that was actually in the state at any point in time, or is it just minors who made this state their permanent residence?
Questions of residence is usually a legal determination, but it usually is an intent to reside in the state. So if someone is in the state on a vacation or just, doesn't have an intent to reside here, I don't think it would, it may not extend to, you had brought up children who are here for, a summer camp. I don't know that would, and necessarily the way this is drafted, extend to minors in that situation. There's been case law about, well, it just wouldn't apply to college students, but, if someone was here for a school year, I think that would be more tend to a student residing in Maine. If they were like a boarding school student, for instance, I think it's a little less. It's kind of a continuum sort of determination. If someone is just here on vacation or for a short period of time for a summer camp, I think that tends to be less of an intent to reside in the state.
My follow-up to that would be if there was, looking ahead, because we don't actually, if this passes into law, and I hope it does, we don't actually know what type of situations might come up that someone would want to take a private right of action, or any of the penalties might be, at that point, whether or not this person was considered a resident, according to the person who is taking the private right, if their child is here, say, going to prep school, or like I said before, the summer camp experience. Do we need, I don't want to push this if it's a non-issue, but do we need further definition of that in case down the line someone does want to pursue some sort of private right of action or whatever, and the entity that was the potential violator says, oh, they weren't residing in the state at that point in time, so this doesn't apply to them.
So I guess that would be a policy decision as to whether or not you think the language as drafted is sufficient for someone who is pursuing affirmatively a private right of action. If the Attorney General's office was enforcing it, they could make that determination about whether or not they would bring an action against a violator. And they would bring the action against the deployer. And, I don't know if anybody from the Attorney General's office is here, but they would have to make a determination, I guess, as to whether or not they would seek to enforce this if there was just one instance, for instance, one minor involved, or whether it would be something where they would be seeking it on behalf of all, more than one minor, which I think lessens maybe the concern that you raised about someone here for a short period of time. It would be more of a concern potentially if a minor who was here on some camp and tried to bring a private right of action. It may be something that's raised as part of that legal case, and then the court would make that determination of whether or not they would have standing under this legislation to bring that right of action.
I mean, I think both of these paragraphs where it says this chapter applies to, and you have 1 and 2, are really just trying to ensure that the state of Maine actually has the legal authority to regulate these businesses, and there has to be some connection to the state, right? So the first section says, well, they do business here. That's one connection. The other connection might be that it affects a minor who's a resident of the state. And those, again, are issues that are litigated all the time in court, absolutely. But I think that's what that's really getting at, is just making that legal connection.
Thank you very much.
Any other clarifying questions for Colleen? Right, so discussion.
Yeah.
Representative Lucci.
Thank you, Madam Chair. I actually really appreciate the sponsors amendment because I think it makes it a lot cleaner. And takes the burden off of us to figure out how to do all of the things that tech is sort of trying to figure out how to do, or sort of putting in our laps. So I'm inclined to support it as is. I haven't, since reading through the testimony and hearing the public hearing, and anything that we've gotten since, nothing has sort of swayed me from the fact that I think we need this, and I like what we have in front of us.
Further discussion. Representative Olson.
I guess I think I'd asked it once before, that whole reasonable person scenario, and where we're gearing this towards minors. Is the interpretation of a reasonable person different for a minor than it is for someone that is not a minor?
Where are you looking?
Well, it's saying under 3A, behavior that would lead a reasonable person to believe. And where
What
we're,
page are you on?
page 1, sorry.
Thank you.
And human-like feature? Yep.
So I mean, if, what is reasonable to an adult is not reasonable to a 15-year-old. And where's the, when this comes down to any kind of adjudication, where does that fall?
And again, generally speaking, a reasonable person would be any reasonable person, you know, unless you clarify it otherwise.
Yeah.
You know.
Yeah.
So it doesn't necessarily mean an adult or a minor.
Yeah.
I guess where, where we're, where our intent here is trying to protect minors.
Yep.
Are the courts going to look at a 20-year-old and say, well, that person wouldn't have thought that, or are they going to look at what they would perceive as what's reasonable for a 15-year-old?
I think without clarifying it further, it would be within the court's discretion as to how they would determine how they would look at that.
Yeah.
And similarly, in the case of a private right of action, and similarly with the Attorney General's office, if they were contemplating bringing an action, enforcement action, they would look at that definition and ask for information from, as I understand it, from the deployer to make a determination as to whether or not the artificial intelligence chatbot was making human-like features available. And so they would use the definition and ask for information from the deployer to make a determination as to whether or not it includes human-like features or not, and whether or not those are being made available to a minor.
Further discussion. So I see we kind of have three, maybe only two, but policy decisions to make. So the first is, the bill is amended, both bans and regulates these chatbots in relation to a minor. So that's kind of the initial question. Do you want to ban them? Do you want to ban them and regulate them? Do you want to just regulate them? And then we did receive a letter from the Retail Association of Maine who was suggesting a stakeholders group, which again, I don't think is necessarily mutually exclusive. We can, you can do all three. You can do any combination of two. Those are kind of the policy decisions that we need to make as a committee. What are people thinking? Representative Clucci.
Thank you, Madam Chair. So, I sort of, when you say we can ban and regulate, doesn't this simply sort of ban?
Well, the way I look at it is, the bottom of page 2, number 2, I think 1 and 2 is a ban. I think number 3 is a regulation.
Wait.
The bottom of 2 and the top of page 3. And you've got 1 and 2 is banning it. And 3 is really regulating it. So that's what I'm referring to.
The provision about mediation.
Yeah. I mean, there's other ways to regulate it too, but that's what's in the bill, right? We can always talk about other regulations we'd like to see, absolutely. What are people thinking? Representative Boyer.
I'm open to a stakeholder group, but I don't think I would want to do that in place of moving the
Yeah,
legislation
that's why I said I
forward.
don't think they're mutually exclusive. I think, we could pass some legislation and then also have a stakeholder group to continue the discussion.
Yeah, I like that idea.
If we wanted to, but Representative Foley.
Yeah, my thought was, I think, passing this with an effective date out.
I knew you were gonna say that.
Feeling.
No, not a letter. Because this gives the stakeholders group something to work with.
Yep.
And they can refine some of the issues and we give it time. I don't know, maybe I don't know what date you'd want to use, a report back or do something by January 1st of 2027, or maybe further out into 2027, maybe February or March or something like that. That's sort of my thinking of moving forward.
Yeah, Representative Mastracchio.
Thank you, Madam Chair. I guess I'm really opposed to waiting. I feel like we've got something, now they've got it, and then they're gonna figure out a way to get around it. So, yeah, well, that's how it works, and it's technology, and we don't understand all of it. So I just think that we need to do something, and as it is, whatever we do, it's not an emergency. It's gonna take, 90 days after adjournment, and I just think it's really important stuff. And I don't want to give them any more time than they've already had because they haven't fixed it. It's just getting worse. I've been on those. I've looked at all the apps. I mean, it's just like, it's exploding. I just think we need to do something. So I'm for banning, regulating, all of it and doing it now.
Representative Matheson.
I tend to agree with Representative Mastracchio. I certainly don't mind studying things, but I think that it's really clear that we need to protect minors. And I'm much more inclined to passing something and banning it and regulating it than I am in studying it.
For the discussion, Representative Arford.
Yes, thank you, Madam Chair. I will vote to take action on this bill and to pass it. I agree completely with my committee mates who are stating that this is not the time to wait. And I'm also reflecting on the governor's task force, her AI task force. And I'm sorry if I don't remember correctly, but what did that task force say about this? Have we reviewed what the task force said about these, if it said anything about it? The only reason I'm bringing that up is to see if it actually has been studied in the near past. So I have no opposition to studying if everybody decided there was something of critical importance to study going ahead, but I would not want it to get in the way of this bill passing now. Thank you.
Representative Olson.
Right. I'm more in favor of doing some regulations, getting something in there, but doing the group, whatever, to help the AG develop the rules. Because the rules are really what's gonna run the thing. If the rules are totally unreasonable, then, that's gonna come out there. But if you get buy-in from both sides there, it's gonna fly through a whole lot simpler than if you're butting heads in there.
Representative Flynn.
Thank you, Madam Chair. My concern with this bill last time, and the questions I asked, was it related to the regulation of the deployers, particularly the Attorney General's office, and I asked for a few simple questions. What were they using to determine what's reasonable age, things of that sort? And the response we get, it's been completely scrubbed from the amendment completely. I've got very deep concern with that, and it hasn't been answered. I think it remains an open issue, and if we go ahead and just pass something, I'm fearful that we're going to create a lot more issues down the road in the very short order.
Oh, yeah, Representative Boyer.
Thank you, Madam Chair. Representative Flynn, are you concerned about what they might use for age verification? Is that what because I think
In the original draft, it stated the deployer shall implement reasonable age verification systems to ensure that such chatbots are not accessible for minors.
So I think we might actually benefit from not naming them because now like apps can use facial recognition. They can just scan your face and have a good guess at how old you are. So I think it's probably more flexible for the Attorney General if we leave it the way it is, because this technology is going to just keep changing and they're going to keep finding different, forget, government issued IDs. Those are like things of the past, right? They have all these other ways to verify how old you are and they have all your data. So they know what you're looking at. So that's one way that they can sort of verify how old you are as well.
Thank you.
Yes. Okay. Representative Matheson.
I just wanted to pose a question to Representative Foley. If we did some sort of a stakeholder group, who is the stakeholder group? Who directs that stakeholder group? Like, who are we asking to get together and who are we asking to oversee that?
Yeah, I would assume the Attorney General's office would be the lead on that.
Convener. Yeah.
Because they're the authority. And the reason that you know, I think that having a study group, there seems to be a lot of confusion over some of the definitions, some of the potential unintended consequences that some of the retail folks have and some others have. And so I think that, you know, passing this so that they have something to work with, and then the stakeholder group can refine those issues, I think would be helpful, especially for the Attorney General's office, when they go to make their rules, to have sort of more of a definite pathway forward. So that's just my thought on it.
Further discussion, Representative Clucci.
So, I kind of liked Rep. Olson's suggestion about like sort of having the stakeholder group help with assisting in rules. Is that something that normally, you know, is that something that's done, or is the rules process, you know, like do that already? I guess.
Yeah.
Well, the rules, once they're initially adopted and proposed by an agency, you know, are shared publicly, and the process allows for public comment on the proposed rules. So that sort of does build in stakeholder comment, but it's sort of after the fact, right? After they've come up with a proposal. There is some language in the APA that sort of does prescribe an ability of an agency to engage in, it's called like consensus-based rulemaking, I think it's called in the statute, that does allow for some process to use and and develop a rule prior, you know, get feedback prior to the introduction of a rule. So that might be something to do, or sort of alternatively, sort of outside that sort of prescribed process, kind of a report back with suggested, you know, asking them to look, you know, Representative Foley suggested specifically the definitions. If you went forward with sort of enacting it as is, perhaps, I don't know, enacting it and then having some, you know, Attorney General consult with stakeholders, you know, and report back to the committee about whether the definition should be changed or in some way, something like that. I don't know if that's too focused. You wanted to, if you wanted, you know, to take a look at broader issues as well, but I guess those might be two alternatives, but that's the rulemaking process does confine sort of public input sort of after the initial rule has been adopted. Of course, then the agency can take that into account and make changes, but it's the separate process I mentioned, I think it's called consensus-based rulemaking. It sets forth a specific process to sort of work with some stakeholders ahead of adopting the rule.
Yeah, Representative Clucci.
So with consensus-based rulemaking, is it sort of binding in that you like absolutely must have, so like I just wanted to make sure that, you know, we wouldn't have sort of, if there's one party that's sort of, you know, going rogue, that you can't have to, you know, that you sort of have to come to consensus before you can do rules, or if there's, you know, a way to.
No, I think it's still the discretion. Ultimately, it's the agency's discretion. I mean, I can look it up while you're talking, because I don't want to misspeak about what the process is.
Representative Foley.
But ultimately, Colleen, if we make a major substantive, it comes back to the legislature, and the legislature can either accept them or not. I mean, that's really, and one of the other things that I like about the stakeholder group, I mean, there are several states that are debating this right now. New York State has a very similar bill, and there were a couple others I can't remember. And that would give the stakeholders group an opportunity to, number one, see what other states have done, what their thoughts are, or they'll see what our thoughts are. I think everybody's trying to figure out what's the best way to do this. And I don't think anybody has the silver lining at this point in time, but I think that a deliberative process would be helpful to try to strengthen whatever it is that we pass.
Representative Mastracchio.
Thank you, Madam Chair. So I'm trying to understand what you want to do, Representative Foley. Is that you want this to be held in abeyance until they write major substantive rules, they come back to the legislature and then it does it? I mean, we're talking 2 years. It could be. What if you don't like
No,
them?
no, I don't
Yeah.
think that's what he means.
Okay, well, I
He
just
was
want to make sure.
suggesting putting the effective date out and then having the stakeholders group meet in the interim, and then come back and report to the legislature in the 133rd. My only concern with that, just to throw another wrinkle in this, is I'm actually okay with pushing out, if you will, the ban part and have stakeholder meet and the AG and kind of talk about definitions and how should we really, when we're talking about banning. But when it comes to regulation and in terms of, that number 3 there, that a deployer shall implement and maintain systems to detect, promptly respond to, report, and mitigate situations in which a minor indicates to a chatbot that the minor intends to harm the minor or commit harm to another person. I think we need to do that immediately. I don't know how we do that, where we take that regulation piece, and, then convene the stakeholders group, to look at the ban, look at, if we need to tweak the definitions, what other states are doing, all of that. Because I am not concerned, that's probably too strong a word. I'm at least cognizant of the potential for unintended consequences. I'm not worried about unintended consequences on this regulation, just saying you need to figure out how to know if you're going to put this out here, this product out here, you need to figure out how to identify and mitigate and help in those situations when it's clear that a minor intends to harm himself or another person. So Representative Cucci.
I have another idea. What if we, because I don't really want to wait and push out the timelines for the ban or the regulation. But what if we push out enforcement actions? The date at which you can start taking enforcement. So we're putting this in place now. And so you really need to be working on trying to, but we're not going to hold your feet to the fire until X date. And still, do this maybe process by which we can have rulemaking and people can weigh in. But I'd like to get it sort of as firm as possible, as soon as possible, but then, yes, give them leeway to not get in trouble for a little bit.
Representative Alford.
Yeah, thank you, Madam Chair. I'm not sure where we are right now. Are we sort of talking about going ahead with at least part of the ban in the bill and doing some sort of a study group that will then come back to the committee and will further elaborate on ongoing legislation that would build on whatever ban we pass at this point in time? Is that where we're headed?
I don't know if that's where we're headed, but that's certainly part of the discussion.
Yeah, so in the report, and I'm sure everybody's taken a look at it, but in the AI report that was published past October, under the protections for minors and from AI related harms, they specifically state pursue near-term legislation and executive action where harmful AI uses are apparent. And then it goes on to talk about that. So I see that's what we're addressing right now. And so we're really in alignment with this report. And it also says conduct dedicated study and ongoing monitoring. So it talks about taking immediate action and conducting ongoing studies. So I think we're right in alignment with this report, which I think is excellent. The only thing I would say at this point, I would have to say I don't agree with, I don't have any problem with the systems to detect and respond, that regulation, but I don't think we should depend on that. This is still technology. And I'm not at all convinced that there's any technology developed at this point that would actually have the ability, if a child was using these AI systems in some way, how it would be able to accurately detect that. And then what would it do? Who would it report that to? And would there be someone on the other end waiting to receive that report and take instant action? So I'm not sure. I'd want to think more about how that would actually work in the real world, because in other realms that I've worked in as a legislator, they've set up systems to detect and respond to harms, and they've been very, very difficult to implement and to realize the outcome which we're hoping for, that we would be able to capture something like that before any harm actually occurred. So that's all I want to say about that. And I'm very excited about us taking action on this, because there's absolutely no doubt in my mind that this is timely, and that the report that was published by our legislature in October is calling on us to do this, and that we should go ahead with that. Thank you.
Representative Clucci.
I was just gonna say, I mean, we heard this morning that the AI sort of capacity and sort of processing power like doubles every 7 months. So I'm pretty sure AI can help them figure out how to do this.
Yeah. Representative Matheson.
Can we just talk through what our main not mine, because I don't have, I'm not sure I can identify them, but what are the main concerns around the ban? Number 2, why are we putting that off? Why is the committee considering putting that off? What is it in that makes you nervous? Number 2.
Just the ban.
Just the ban. Is there anything in that wording that makes the committee nervous? Number 2, page 3, number 2. I'm just trying to figure out mostly, yeah.
Yeah, number 1, 2. I
Yeah.
mean, they're both banning
1 and
it.
2, yeah.
Again, for me, it's the unintended consequences, or the possible unintended consequences. And scooping in that things that we're not really intending to scoop in, or, I mean, you know, I got an email, I shared it with the bill sponsor from a constituent whose son is autistic. And he does use one of these companions, and it helps him. So are we saying he can't do that anymore? And what other kind of maybe unintended consequences are we scooping up? I mean, I understand, you know, why we want to like severely limit access, maybe to the point of a ban, but I don't know. So that's my hesitation. Again, it doesn't rise to the level of a concern, but there is hesitation. And so I would appreciate the time to have the AG's office do a stakeholders group and get back to us on that issue. And, you know, what are the possible unintended consequences and how do we deal with that? Do we deal with it by tweaking the definitions? Maybe that's how you deal with it. Do we deal with it with, again, coming up with some exemptions? But, you know, I don't even know what that should say. I don't know enough to know what possible exemptions. Again, how do you define, well, okay, maybe it's okay if, you know, the child is autistic and the parent approves of that. I don't, you know,
Right.
I don't know, even know how to define that. So I would like people who maybe do know more to be able to get together and talk and give us more guidance. So Representative Foley.
Thank you much, Ed. Colleen, is there any way that we can enact a portion of the bill to go into effect 90 days or whatever, and then the rest of the bill with an effective date further out? Or do we have
And
to?
do the stakeholders group.
Yeah, I mean, you could have one part be effective immediately and another part be delayed. You could, yeah.
So
And
so
have
we
it
can do that
group
in
the-
one bill? We wouldn't have to.
You can have different, separate it into parts, but yeah, you could have different effective dates if you wanted to for different provisions. You could do that. yeah.
Do the regulation part with an emergency. I mean, again, you can do that tomorrow. I'm more than comfortable with that. Yeah. Interesting. Representative Olson.
Thank you. Yeah, I mean, the issue that I would have with the flat out ban under 3 is there are other potential, I can see uses on the education side and things like that where you could have that where it could be used in the classroom and things like that. And so are you then shutting those abilities off? Those are the things that have to get looked at is what are, what are the programs that are out there? How are they working? And, are they a benefit or, are they, because what we're really trying to do is we're trying to protect them from the ones that will try and cause them harm. But if we're in this, at the same time, we ban ones that can do help to someone, then really we're not doing our full job. Kind of the way I look at it there. So by getting a chance to get people together and hash more of this stuff out and get more data from what other people, what other states are doing, what is out there in the industry, what other groups, as in education and things like that, are using this, how they're using it, and make sure that we're not shutting the barn door totally on something that could be useful.
Representative Clucci.
Could we consider, rather than delaying, could we consider a situation where we have the AG's office report back to us at this, in January or, of next year, or February, with what are the concerns that they've heard about the unintended consequences, and have us, have legislation triggered to that. So it's, in a way, it's going to guarantee that we have a mechanism to address the unintended consequences. And again, if we were to delay enforcement, we could get this sort of ban on the books. We could be taking in the complaints that we're hearing so that we can address it in the future. And get the tech companies trying to figure out how they're going to comply with the ban now rather than wait.
Further discussion? Representative Arford.
Thank you very much. I do think it's important, the ongoing study part about this, regardless of what we pass today, because there's so much nuance here. When you mentioned the autistic child, it reminded me that I have an autistic nephew who's 3 years old, and they live in Sweden. So he's already receiving a great deal of services. He's already been evaluated. The government provides all these services to young people. And this young man is absolutely he watches 3 different cartoon shows, and that's all he'll do. He'll sit in front of the TV and he'll watch these cartoon shows. So he clearly has developed a relationship with these cartoon characters in these cartoon shows. And so I would say that's true of all children. All children, as they grow up, sometimes will watch TV and develop relationship with cartoon characters and things like that. So the key to me between something like that, which I would say was relatively helpful, and what this is first of all, they're using human-like features. That's critical and key to this. And these systems are designed to engage at that level. It's not a byproduct. It's designed to do that. And that's, I think, where we run into trouble, the ways in which that does end up engaging young people. We don't yet understand how deep that goes, how far that goes, including autistic children. I would say the danger exists for them as much as it does for other children. But I think absolutely you bring an excellent point up that we need to study this. And we definitely do not want to deny something that would end up having a significant positive impact. We do not want to get in the way of that. That's why we need to study it further. So thank you for bringing that up. I appreciate that.
Further discussion. Representative Mastracchio.
Thank you, Madam Chair. So I have a question. If I was the parent of the autistic child, I would probably just go and sign up for that little friend bot myself and then let them watch it on. There's plenty of workarounds. I'm not really worried about those cases because I do think that will take care of itself. And if it can't, then they'll come back to us. But I am really feeling very strongly that we need to do something. And I don't have a problem with the ban because I do think that there's a way that you can, I'm sure there are people in Australia who want their kids on social media because they don't agree with the government and they just go on and get it themselves and said, here, have a party. You know, there's always going to be the people who, you know, have parties at their houses for kids and let them drink illegally. So I guess I don't see the big deal. There's always workarounds. People will always find a way to break. Not me, because we didn't have the internet. Thank God.
It was always interesting that as a kid, you knew what house that was.
Yes. Whoa, you did though, didn't you?
You did.
Even as an adult, I knew the houses that I didn't want my kid to go to.
Yeah.
And the parents thought you didn't know, but we knew, and we didn't have the internet. We didn't have social media. We just had parents who talked a lot.
Yeah.
That was the other dead of the time.
Further discussion. So do people want to do a corner caucus? Yeah, I thought I kind of thought we had reached that point. All right. So we'll take probably 5-10 minutes. All right, welcome back after corner caucuses. We are back discussing LD 2162. And Representative Foley, if you want to kind of summarize where you think we're at
Yeah, we,
on mic, please.
thank you, Madam Chair. We certainly believe that, enacting number 3, immediately is an important feature. To try to protect, I was just telling folks that I read a news article the other day about one of the school shooters, had talked to a chat box and told them what they were gonna do. And nobody did anything about it. So that is something that, and I'm sure, I mean, if I mention on my phone that I want to look for a new car, it starts blowing up. So they know they have this technology, so it's doable. So our thought would be to enact number 3, and we could do it as an emergency. Then enact the rest of it with an effective date of 1/1/2027. Convene a stakeholder group by the Attorney General's office and have shall adopt rules and make a major substantive report back to the legislature. I guess that's pretty much where we're at.
Did you say stakeholder group and major substantive rules?
Yes.
Okay.
And the shall adopt rules, not may.
Yeah. So does it go into effect before the rules go into effect?
Number
Yes.
3 does.
No,
Number
no,
3
the
does.
rest of it, does the rest of it go into effect before the rules go into effect? So, the ban is in
Yes.
place pending the adoption of the rules that you'll review, or do you want to make it all contingent on the rules being approved by the legislature?
I would have the rules.
I would
That's the
have it,
question.
I would have it go into effect, but we should put a date for the stakeholder group to
Right.
report back.
Right,
I mean, one would hope that do it in conjunction, but
right.
I don't know.
But I guess my question is, if you put the rest of it in effect on 1/1/27, the AG's office would be able to enforce it, even though rules aren't in place yet that have been removed, and is that your intent, or do you want to make sure the rules are in place before do you know what I'm saying? That's the question.
Representative
How
Mastracchio.
do you want
Well,
to handle?
my preference is for it to go into effect regardless of whether the rules are done, because it's the only way they're going to write those rules if it's in effect. So
Well, yeah,
But I think you can have a date for the rules to come back.
well, that's
can-
that's also true. You can specify when the rules
You
come
can
back
say,
to you. Yeah.
convene the stakeholder group.
Yep.
Report back to the legislature with rules.
Yep.
By 1/1/2027.
15.
Or,
115 maybe.
probably,
Yeah.
somebody, yeah, or maybe 2/1/2027 gives. But then, require them to come back with the rules. And this would go into effect once the rules were adopted. The rest of it would, number 3 is
That's the
already.
question, and that's why I was asking. Yeah,
And Colin, we can do that, right? We can take out that one section and just have an emergency preamble just on that. Okay, cool. We will.
well, you can have an emergency preamble on the whole thing, but the only thing that takes effect as an emergency is that one
Oh, that's
piece,
how
and
you
then the
do it.
rest will have the delayed effective date, but that's essentially, so the whole bill, unless, will still have to be supported by 2/3, but you can have different effective dates for parts of the legislation.
that's how we
So
do
the
it.
first
Okay.
piece will go into effect immediately, and then this question about the immediate enactment, would it still be the same penalties for the subsection 3
Yes.
for both? So the penalties would be in place
For number 3.
for number
For
3
number 3.
until the others, okay,
Yes.
okay,
Representative Cooch.
including penalties.
Could we put an emergency on the stakeholder group as well so that that can start immediately so that they can get the rules going sooner?
They can start it whenever.
Yeah, but there's
'Cause it's a
also,
stakeholder
it would,
It's
yeah,
it's a stakeholder group.
It's not a
it would all be an emergency anyway.
Right, but okay, but if, so here's the concern that, so then, but we wouldn't do major substantive rules, right? Because if we did major substantive rules, then we would have to, it wouldn't be until the legislature adjourn, it wouldn't be until fall of probably 2027 that these would go into effect.
We're gonna put we're putting a date on for when they have to have done the rules.
No, I understand, but if they're major substantive rules, then we have to approve them before they can go into effect. And if we have to approve them, then the
They're
soonest
always
they
done
would.
as emergencies, the major substantive rules, so they have a 2/3 support. They're always presented to the legislature as emergencies. The review of the rules,
And if we don't get 2/3,
then if you don't get the 2/3, then they would. be
then it
delayed.
would be, we would be delaying implementation of these for until.
Right. Which is why I think we were saying the other part would go into effect. Colleen, if you could summarize.
I think there's
what
a
you
disconnect
understand.
then, I think, between what you said
Yeah.
and what
Yeah.
you said, but.
I saw that in everyone's face, so that's why I'm like,
So
okay,
let me,
Colleen.
yeah, let me.
Tell us what we
What I
mean.
think Representative Foley was proposing, when he hasn't there hasn't been a motion made yet, but, if you're looking at the pink sheet.
Yep.
You would add an emergency preamble and an emergency clause. Subsection 3 at the top of page 3 would be enacted to go into effect with the intention that it would go into effect immediately. Would also include penalties that are there. So that would be part A, and that would have an immediate effective date, assuming the emergency is adopted by the legislature. Then there would be a part B of the bill. And you would be enacting subsections 1 and 2 at the bottom of page 2 and the top of page 3 with the same penalties, with a rulemaking provision that would direct the Attorney General to shall adopt rules. The rules would be major substantive. You'd have two unallocated sections of law, I guess. One would be the Attorney General to convene a stakeholder group, I think, to look at whether or not there need to be any changes to the legislation and report back to the committee February 1, 2027. Then you also would be asking the Attorney General to adopt major substantive rules by that same date. And report back to the committee so it could be considered. It'd probably be a little later than that. Maybe not 2/1 because it wouldn't go into effect until 1/1, so you want to give them a little time. Do you know what I mean? Like the
Oh.
statute doesn't go into effect until 1/1/27, which I think is what you said.
Right, 1/1/27.
1/1/27 for subsections 2 and 3. So the question where I think there might be a disconnect is, I heard Representative Foley say that he didn't want, even though the legislation would be in effect 1/1/27, he didn't want any action to be taken under the statutory provisions until the major substantive rules were adopted, meaning they couldn't be enforced until the legislature approved the rule. But I didn't think that's what you said.
Well, no, what I just heard you say though is they can't start the rules until it goes into effect.
Right.
So how do we get around that? 'Cause
So
we want
you could
them
have a
to start
1/1
on-
effective date, right?
But we want them to start working on the
Yeah.
rules before
Yeah.
1/1/27.
So you could, two ways, you could say at the beginning of subsections 2 and 3, beginning 1/1/27, the rest of this would take effect sometime over the summer. But beginning 1/1/27, it's banned, or whatever the date is, you want to put it. And then you'd have rulemaking shall adopt rules. So essentially it would go into effect 90 days after the legislature adjourns, but nothing could happen until the major substantive rules were in place. You could put the dates in there, meaning the ban doesn't start. And even though the whole law goes into effect, the ban doesn't begin until the major substantive rules are adopted or a date that you would decide. Is that what you would want? You can do that.
Yeah, if we're talking about 2/1/27.
Yeah.
But
It's a little tricky, but have to figure it out, but we can make it all work that way,
Okay.
if that's what you want.
Representative Matheson.
Is it necessary for the committee to have major substantive rules with this when we have the delay in the stakeholder group and the delayed effective date? Because I just feel like that puts the law in effect later and later and later until the major substantive rules are in effect. I mean, the whole reason, my understanding was that we were doing this stakeholder so that they could propagate rules to enforce the ban on 1/1/27. So why are we putting another parameter there to push it out even more for the legislature to say yes or no to those major substantive?
Yeah, and I guess the other question is if they're doing a stakeholder group and again, they might recommend changes, right? Which we're asking them to look at. So do we really want them working on rules when we might change it? So yeah.
Yeah, I mean, and you could, with the stakeholder led group, I mean, I'm assuming what you do with most stakeholder groups, you would give the committee the authority to report out a bill in response to that.
Yes.
So as part of the stakeholder group, you could be asking them to provide to you any recommended statutory changes, but you could also ask them to give you a draft rule, similar to what you asked the Board of Nursing to do.
Yeah, so at least we
Um,
can see them.
So at least you can see if they even think rules are necessary and what they would look like. So perhaps you could take that
we
kind
can
of
report
approach.
out.
And then if you didn't, legislature
can
didn't
report
like
out
it,
yeah.
they could enact legislation during that next legislative session and perhaps even make it retroactive back to that 1/1/27. You know, you would have that ability to make those changes. I don't know if that works better.
I think so.
I mean, I feel like
Process-wise,
that
but
makes
that's it's tricky.
process, I mean, it gives you
Tricky to
that
make.
time. It gives them that time to do the stakeholder group. It gives us an opportunity to see the rules like we just did with the nurse practitioner. It forced that date. But it also offers an opportunity for the committee to come back and report out a bill if we're not comfortable with what happened. So I'm comfortable with that. I would prefer that than to push it out until the legislature goes through the whole process of major substantive. That's just my personal.
Further discussion, Representative Arford.
Thank you, Madam Chair. So to make sure I understand this, we'll pass as an emergency, number 3 on page 3. And we'll amend this by saying that we will send to the Attorney General's office that they will form a stakeholder group to promulgate rules to enforce the entire bill or just 1 and 2? Is it the entire bill?
Well, again, the stakeholders group isn't necessarily to promulgate rules. It's to look at the legislation and recommend any changes and from input from the stakeholders.
Okay, I forgot too, penalties and remedies would go into effect along with number 3, correct? Right away.
In regards to.
So anyhow, the Attorney General's stakeholder group, do we know who the stakeholder group will be? Are we just going to allow them to put together okay. And then they will report back to these are going to be major substantive rules. They'll report back by what date?
January 1, maybe, or January 15.
Yeah, we had said January, you had said 2/1/27 was.
Somebody had said January 15th and somebody said February 1st. So either, it could be either, but yeah.
If it's.
In any event, you know, you're going to see this again before you.
Yes.
For it. Yeah.
Okay, so anyhow, let's just say January 1st. And then at that point, we'd go through a similar process as we did with the nurses, with the rules for the nurses supervised period of time after they were licensed. And we would consider those rules. And once we had passed them or whatever we did with them, once we'd taken action, the bill would go into effect, number 2 and 3.
No.
When would 2 and 3 go into effect then? I mean, not 2 and 3, 1 and 2.
Yeah, whatever date we decide it goes into effect. The stakeholder group and the review of any proposed rules would just give us the opportunity, the committee, an opportunity to report out legislation. So if the stakeholder group comes back and says, oh, I think you really need to change this definition, that's not going to be workable, then we'd report out a bill to do that. And or if we saw their proposed rules and we didn't like certain sections, we could put that in a bill.
But the bill would already have gone into effect on the first of next year. So whatever we do is going to be after the fact.
Yes.
So my question is, why wait? If what we're going to be doing is going to be after the fact anyhow, there's no way we can do the rules before the bill, at least 1 and 2 goes into effect. There's no way we can do it unless we ask them to report back to us in a week or two's time and hope we don't run out of time in other words, there's just no way we can do it. So why wait? And I just want to make one other point. I'm not a fan of this. I'm not saying I won't vote for it, but I'm certainly not a fan of it. We're acknowledging in number 3, by saying we want to pass it as an emergency, that these systems are dangerous. We're requiring the people who are administering these systems now to put in place this fail-safe. And I'm not at all convinced that that's possible and that it will be implementable. But anyhow, let's say it was, we're still requiring them to have this fail-safe in case a minor decides based on their interaction with this, the relation with, that they're going to harm themselves or someone else, there needs to be this fail-safe. And then we're also saying that we're giving certain individuals, parents, et cetera, right of action. So we're really acknowledging that these are dangerous. And yet we're not going to put the ban into effect immediately. To me, that does not make sense. It makes so much more sense to pass the bill along with the rulemaking or whatever we're going to call it, to consider that the beginning of next session. And if there are substantial recommendations, we can always amend the bill at that point in time. But we'll have the protections in place. So I'd love to hear from someone that can convince me that it actually makes sense to wait, because I haven't heard anything that's convinced me of that. Thank you.
Further discussion. Representative Foley.
Thank you, Madam Chair. I think Senator Bailey expressed it very well, that there are potential unintended consequences to parts of this bill that we haven't been totally flushed out yet, and what consequences they may have. As she mentioned, the autistic child who uses chat box now so I think that's what you want to flush out in 1 and 2 in order to make sure that there aren't unintended consequences, or that you identify them and you figure workarounds or ways of addressing those. So that's as I understood it, was the reason for not doing 1 and 2 immediately, but flushing some of the issues that are out there that have been identified by some of the folks that have written to us and testified.
Representative Chimino.
Thank you, Madam Chair. I also think that we should wait before the rest of this goes into effect. I think we should wait until we hear back from the stakeholder group, because to me, it's confusing. If you put the bill forward and then we have to go back and make changes to it, I just think that whole process is a little bit more than it needs to be. So I would rather wait until the stakeholder group comes back and gives us the information, and then we can go on with the rest of the bill and having it implemented.
So what dates would you suggest for both the stakeholder group? I mean, the 2 dates I think we need is the stakeholder group report back date and the effective date of, we're calling it 1 and 2, but I think we all know what that means.
I think if the stakeholder group gets back to us by 2/1, that then we should be able to go ahead and then look at that information and then proceed with the bill at that point. And I don't know, maybe it doesn't work that way. So it's something you can tell me, but I just want to make sure
What I
that,
hear you saying is though, that you want the stakeholder group report back to the committee, that date to be before the effective date of the bill.
correct. That way we're not having, like, if the stakeholder group comes back and says, we've looked at some other legislation, like some stuff in the New York, what they're doing in New York, and they look at that and they go, they have some really great definitions in there. They have a suicide hotline, money going into a suicide fund. This is stuff that we actually want to incorporate into our bill. I think we should be able to do that rather than have a bill go out that's not complete. And then we have to go back and we have to start making changes to it.
So what do people think about the dates? Representative Olson.
what you could do there is to make your effective date X number, X number of days after the report back from the stakeholder group and whatnot. That way, you still have an enactment date there.
I
but
don't
it's
think we can
really-
do that, can we? I mean, I think we need to specify.
It's a little
a
easier to
date.
make a specified date, but you could say, if the
well-
report back is February 1st, your effective date could be April 1st or May 1st or June 1st or
but
something,
the
it could
the
be
next-
soon after
yeah.
that. But yeah.
So, I mean, so we define the report back date and we define what that waiting period is, because that waiting period gives the chance to look at and make any technical corrections that we need to do.
Right. Right. So again, the two dates are the report back for the stakeholder group and the effective date of 1 and 2. Representative Matheson.
So since I was compromising on the effective date in January, I'm not interested in February 1st, but I certainly understand what you're saying, Representative Chimino. So my suggestion would be if we want to do that, if we want to wait for the effective date for 1 and 2, then I would suggest 1/15 be the report back and 2/15 or 2/1 be the effective date. So it pushes the time frame. It takes care of some of the concerns, and I don't disagree with you that sometimes it might be good to wait for that, but I would want the effective date very specifically stated on the bill as well.
So you're suggesting 1/15 and 2/15?
Yeah, I was actually suggesting 1/15 and 2/1. But if that's too much, yeah, or 1/1 and 2/1, that I would be okay with that too. Yeah, as soon as possible, I guess is the best, is absolutely as soon as possible. Yeah.
Yeah, yeah.
Effective date, June 1st.
Representative Chimino, I think you had your hand up.
No, I was gonna say, I agree with that. I'm good with that, but I think there needs to be a month in between when the stakeholders come back to us and when we're able to put something forward.
Okay.
That's fine.
Yep. Representative Arford.
I also do want to just point out that when we come back in January, according to what I have been hearing, we're going to be minus at least 2 members that are not running for reelection. And so it's not like we're going to have the same group, the same constellation that know everything we know right now, reviewing these in the future. Or we may have different people appointed to the committee. There's no guarantee that those of us who are sitting right now making this decision will be here after January 1st. And that's another reason that adds to my concern about how I know I'm in a minority right now. I get that, but I'm really not able to stretch right now to agree that it's a good idea to wait on implementation. We're acknowledging that this is a serious, serious matter. We're acknowledging that it's potentially very harmful to minors in our state, and yet we're postponing doing what we could do right now to put the best solution forward for right now, knowing that we can amend it in the future, in the very, after the beginning of the year, knowing that we could amend it if it's just simply doesn't make sense at that point. So I'm just thinking about, someone just shared a story of another person who had taken their own life in relationship to some relationship they had with a chat box, whatever. And I'm just imagining if that happened in our state, what would be the long-term consequences of that, knowing that we can act to prevent that right now? I'm just not understanding the delay.
Yeah. Representative Clucci, did you still?
Well, I'm just still trying to clarify. So are we suggesting that the rules are not going to be major substantive anymore? Okay.
But that they would, when they came back with the stakeholder group, the Attorney General's office would also bring any proposed.
Identify
rules.
if they need rules and what those rules would be as part of the stakeholder process.
Good. Representative Chimino.
Well, just to answer Representative Arford, that's why we're going and enacting Section 3, because Section 3 is to prevent that harm to minors. So we would be doing that. It's just the rest of it we're not going into. To me, I think, I know we're all anxious to go ahead and get something out there, but at the same time, I think we have to be responsible with what we're putting out there. And with the rest of the bill, there's too many unknowns with it. So that's why I'm for waiting.
Yeah. Representative Arthur?
I'm not in the habit of responding directly to other members' comments, but because my
It's
respective.
okay in a work session.
I know, but my respective colleague has responded to my comments. I will simply say this. In my mind, there's a significant difference between a ban, which would happen with 1 and 2, which would just simply go into effect, and asking them to create some sort of technology that would be able to detect and respond when a minor indicates they intend to do harm. I mean, that's a heavy lift. It may not be a heavy lift to try to, I don't know how you do it, but do that. But then to have a response, who will they be reporting this to? It's not like we're going to have an AI minor respond to possible suicide ideation, emergency squad roving the streets, just waiting to hear what child's trying wanting to do
either
that.
they can do it, or if they can't, then they won't be allowed to have a chat bot in Maine. So they can either figure out how to do it, or they won't be operating in Maine. So that's going to be their choice.
I don't see that this reads that if they don't have that system in place, they won't, because there's these devices.
Because if they can't do it, then they can't operate in Maine. This says they have to do this.
Where does it say that? I'm not challenging, I just really.
Well, if this goes into effect, then
Uh-huh.
that is what they have to follow the law, right? And if they
Right,
can't
but
follow
the-
the law, then they're
Mhm.
breaking the law. And they will suffer the
Right.
consequences.
And if I was a deplorer, I would say, okay, this law just went into effect. I need 6 months to put this system in place and have
And
it
that's-
operationalized.
That's fine. They can do
Well,
that.
I just was saying what's not fine to me is the amount of time it might take to deploy a system like that. I'm not even convinced that it would be the success rate for some, I mean, it's completely unknown. What isn't an unknown is that if we pass a ban, it stops for now. It may come back in the future with new rules and whatever we decide in the future, but for the moment that ban went into effect, it would be, these devices would not be available in our state. And that's what I'd like to see happen. And I won't say anything more about it because I think I've made myself clear.
You good? Further discussion? No, I was just gonna ask if time for a motion? Representative Foley? Yeah.
Yes, I'll make a motion that we enact number 3 on page 3 with an emergency preamble. And that we pass the remainder of the bill with a stakeholders group by the Attorney General's office, and that they report back to the legislature 1/15/2027 with an effective date of 2/15/2027. And do we need to put in there that we can make legislation if authorize that?
Okay.
I think I captured most of it.
Okay, I'll second that. Yeah, absolutely.
Thank you, Madam Chair. So the definition piece, does that go with the emergency? Because
Yeah, I
that
think-
would be my
You would
understanding.
need the definitions for both pieces.
Right.
So they would be there.
And as
then
well as the
report back would hopefully give you some suggestions if they think changes need to be made to those.
I just want to make sure there's
Yeah.
no confusion about
Yeah.
what's in effect
And
immediately.
penalties and violations.
And the same thing, the
obviously,
penalties and
will go with
violations
both.
wouldn't change if you enact subsection 3.
Okay.
It's gonna go, the definitions would stay because you need to define the terms. The penalties would stay because you need something, and then part B, same thing. It'd
I
be
trust you.
effective
Thank
on
you,
that,
Colleen.
on 2/15, and then you'd have a report back on 1/15 about suggested changes that might be needed to the legislation, definitions included. and recommendations as to whether or not proposed new rules are necessary, and if they are necessary, what are those proposed rules? That,
And report out.
Yes.
yes, and then authority to report on a bill. Yep.
Further discussion or clarification needed? I think we are ready, Edna. Yes.
Sandra Bailey.
Yeah, I did.
Thank you. Senator Bailey.
Yes.
Senator Bailey, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Alford.
No.
Representative Alford, no. Representative Boyer.
Yes.
Representative Boyer, yes. Representative Shabino.
Yes.
Representative Shabino, yes. Representative Clucci.
Yes.
Representative Clucci, yes. Representative Flynn.
Yes.
Representative Flynn, yes. Representative Foley.
Yes.
Representative Foley, yes. Representative Mastracchio.
Yes.
Representative Mastracchio, yes. Representative Morris.
No.
Representative Morris, no. Representative Olson.
Yes.
Representative Olson, yes. 9 members of the committee having voted in the affirmative and 2 in the negative. Being
Representative Arford, what is your report on Mike, please?
Thank you, Madam Chair. I would like, ought to amend as amended with passage of the bill as it's currently written, adding on to it the part about going to the Attorney General and the whole part about the stakeholder group and reporting back to us, and us at that point having the ability to either write a new piece of legislation or amend this bill or whatever we want to do basically at that point in time.
Okay, and
With an immediate effective date.
Excuse me?
With an immediate effective date for everything, and then the stakeholder
Mhm.
group would report
Mhm.
back. Okay.
Using the same dates that are in the other bill, I mean, in the majority bill. For the stakeholder group.
oh, for the stakeholder
The
group.
stakeholder group would report back 115, but
Right.
the whole bill, the substance of the bill would take effect when it's
Exactly.
enacted.
Yes. So in other words, what we're choosing to do with everything but 1 and 2, I choose to do with 1 and 2 as well.
Yeah. Thank you.
Yes.
Representative Morris.
Yes, mine is the New York legislation that was, and I can give you the language.
Okay, all right. Thank you all very much. All right. That closes the work session LD 2162, and we'll take up another easy bill to talk about, LD 2208.
It's just all the sort of language all put together.
Oh,
Full people
okay.
Look at it or not.
Okay, thank you. I'm like, what are we getting on a green sheet? Look at that big.
I don't have to go through it, it's just if you wanted to see the language
Oh,
all put together.
You're right.
that's-
Thank you for that reminder. 2208. Oh, wait a second.
So Edna's distributing an amendment, and the green language really is just
Colleen,
incorporating.
Before you,
Oh, sure.
is she down there or did she leave? Yeah.
So.
I was just, Representative Arford had asked us to reconsider a bill. And I'm also cognizant of the fact that she had to leave at some point for a doctor's appointment. Did she leave?
Does not.
She will be back. Okay. So,
We're ready to do that whenever too.
so hopefully, yes, I don't want to forget.
Yep.
And again, I know she has to leave at some point. I think.
canceled. I think so. She was calling her doctor. She wasn't sure.
Oh, okay. Okay, we'll find out when she comes back. So, sorry, Colleen, go ahead.
You want to.
Well, we can't do anything. Yeah, we can't do anything till she comes back, but.
Sure. So I was just saying what Edna just distributed on green is really just a combination of the speaker's proposed amendment to LD 2208 and the pink language that was shared at the last work session. I just sort of combined them in there, and then there's also some language added. The committee had talked about the treatment of subsidies and the tax purposes. And I also put, if the committee is interested, some language in there that might seek to address that.
you?
So I can
identify
show you where all the
oh,
language
oh,
is,
okay,
yeah,
thank you.
if you want, but it really just so you'd see it all on one piece of paper instead of having to work between two different ones. So this incorporates, as I mentioned, the changes that were in the speaker's proposed amendment that was presented prior to the public hearing. And then if you look at page 2, there's a new section on funding eligibility, which adds language sort of consistent with what was handed out at Pink at the last work session, which would say as a condition of accepting grants by the department from the Rural Health Stabilization Fund, a hospital or health system shall meet the following requirements, and they'd be requirements that hospitals would have to meet certain annual growth of hospital facility price limits and certain price limits in terms of the charges that they would be collecting for a period of 5 years from the disbursement of funds. Participating hospital or health system may not charge or collect payment that exceeds 200% of the Medicare rate. And then that language is put in place there. There's some penalties. Failure to comply would subject them to a civil violation, a monetary fine. There's also a requirement that the funding would be returned to the state. And then if you look at page 4, in the middle of page 4, just providing some language. If the committee had been discussing this, if you're interested, that to the greatest extent permissible under federal law, the department shall implement this section in a manner that minimizes the impact of any subsidy on a recipient's income for federal tax purposes, and then notwithstanding any other provision of law for state income tax purposes, the amount of any subsidy provided to a recipient may not be considered income. So in the event this went forward, it would require, like when the department is sort of operationalizing the subsidy program, a state subsidy program, they would do it in a way that tries to minimize any federal tax implications, and then would say that there shouldn't be any state income tax implications for a recipient of a subsidy. Otherwise, there are no other changes, but thought it might be helpful just to have it all in one spot for your purposes of your discussion.
Thank you, Colleen. So further discussion, Representative Mastracchio.
Thank you, Madam Chair. Colleen, I'm just trying to, all right, I see where under 22 MRSA, section 1730B or chapter, what it says 1, and then the Rural Health Stabilization Fund, then I see that's all crossed off after that paragraph. And then the next one is 3, funding eligibility.
Yeah, that's probably just a typo
It's
in the
just a type,
numbers.
so there's nothing I'm missing. It's
No.
just a wrong number. Okay.
Yep,
Just want to make sure.
just a wrong number.
Thank you. Further discussion, Representative Mastracchio. Matheson, one of those long M words.
That's okay. I always
They're really
call-
not that
I
much alike.
call Representative Flynn Foley all the time for some reason, those Fs and those Ms. So I'm wondering about the committee's appetite on making some changes here about the Megara funding. I'm interested in a consistent funding and annual funding, and maybe offsetting the per member per month fee associated to an annual fund. Like if we did $40 million as an annual funding, and then we removed the per member per month $4 fee, then that might be a nice addition to this. Just wondering what the appetite is of the committee on that.
Representative Clucci.
Well, so yeah, the thought I had on that piece was, I think when I was looking at the language for 519, and it wasn't there a proposal to sort of sweep from the general fund at the end of the year? Like that's where the Megara funding was going to come from. Yeah. So, I was just thinking maybe we could sort of, yeah, change it to ongoing. And yes, I like the idea of getting rid of the per member per month fees and instead funding Megara through that sweep.
I don't know what you mean by a sweep, but I mean, what Representative Matheson is proposing is that it's an ongoing general appropriation at $40 million a year.
Yes. That's, yeah, I like that too.
Okay.
That's what I was. Yeah, no, it's great. I mean, I just said it better.
Okay.
I think my committee actually understood what I said, right? Okay, thank you.
I knew what you meant. Absolutely. Any other discussion, changes? I mean, I had asked if people had any ideas of other metrics that they wanted to put in for the hospital funding. Again, just the idea of using a carrot to, kind of encourage hospitals to help us keep costs down and or, if there were other metrics that people were interested in. Representative Clucci.
Okay, so here are my thoughts that I had on sort of number one, the Rural Health Stabilization Program. So, I mean, it's $50 million, but it seems like based on the language, we're talking about that it really would be going more to hospitals. Because with the carrot stick and the carrot stick, but also like it's not a ton of money when we're thinking about like hospitals. And so I think my preference would be if we had $50 million to spend somewhere, I would put it into primary care, like federally qualified health centers as a way to sort of stabilize rural healthcare. Rather than focusing it on hospitals, I would focus on primary care.
Representative Arford.
Yeah, well, two thoughts. First of all, in terms of, I understand that there's a similar bill being heard over Health and Human Services and that they did have a public hearing on a bill that dealt with some issues very similar to this, and that there was significant pushback from the hospitals regarding, at least I'm talking about number one, the Rural Health Hospital Health Stabilization Fund program. And I'm just saying I haven't heard those arguments myself. So that's one of the, I'm feeling a little bit uncomfortable about that. But what I will say is I certainly support a cost control mechanism like this. But my question is, how will we, so is it still that the funding will hinge on achieving the 200% reference pricing goal?
Agreeing to it, yes.
So how will we know that? How will we know that any
The
entity?
department will monitor that.
So they will be able to determine that. They have confirmed that they will be able to provide that data to us.
Yes.
Okay, well, that's very good news.
Yeah, so this would allow them to receive the funding, and then as a condition of receiving the funding for 5 years, they would have to meet those benchmarks that are laid out. So it's
And-
not you have to prove it before you get the funding. It's you get the
Right.
funding, then you agree for 5 years to meet these standards, but there
And
is
we
enforcement.
would be, and the department would be able to provide us with that data.
Well, the language provides enforcement, so if they don't comply, there'd be a civil penalty, and then they would be required to return the funds to the state if they didn't meet the standards, so the understanding is they would be able to determine that. I understand, they'd be able to use that language to determine whether or not a hospital was complying.
Representative Matheson.
Thank you. Thank you. I was just curious, a little bit building up on what you were saying, Representative Clucci, is there some sort of a metrics where we want to establish the requirements for this funding to access rural healthcare? I mean, I don't know how to define that. The department would have to define that, but maybe that goes towards what you were trying to reach towards is access to rural healthcare. Is there a way of defining that?
Well, I mean, the bill already ties it to the Rural Health Transformation Program. So, and it's initiatives that benefit
Right.
rural health providers in the state and promote access and affordability of healthcare for residents in the state in rural areas. I mean, the word rural is in there 3 times. I'm not sure how much clearer it could be.
It's fair.
Yeah,
That's fair.
I think the intent is,
I mean, it would require that the funding be provided in, within the parameters of the grant program though. So if you
Right.
wanted to go beyond that, you'd have to change it, but that's one thing to keep in mind. And you did have some testimony about some of the limitations of the current program, but the way this is written, it's aligning with those initiatives that have already been approved as part of the program, the grant.
Representative Olson.
Now, thank you, Madam Chair, that the issue that I see here, with that limiting to the 200% of Medicare rate. So supposing the hospital gets $500,000 out of the grant.
I can't imagine a hospital would ask for a grant and agree to that limitation for $500,000, but go ahead.
But,
I-
But I mean, I think you see where I'm going here, so all of a sudden now they're limited for 5 years to 200% of the Medicare rate, which means essentially they're going to lose money.
Right, which is why I don't think they would even apply for the
And
grant.
so, so then the real question, I mean, you've got a $50 million pool there. I can't, in my mind, I can't do the math that says that even if they get the full 50 million, limiting them to that 200%, there's, you're into shutdowns. Because they're giving, right now, where they're making up the difference is between the Medicare patients and the main care patients and things like that, and what they're getting from the private insurers. And so what you're doing is limiting what their ability is to get from the private insurers, which is one area. The second thing is now the state has gone into negotiating for the carriers, which I don't think we should be doing either. Because now you've limited the ability of the carrier to negotiate a reasonable rate from the hospital.
Yeah, but remember, this is all voluntary, so a hospital doesn't have to ask for this grant money. And so, but you're right, that's the consideration they're gonna weigh, right? They're gonna say, well, if we get 20 million from this, can we live with this condition of the 200% of Medicare? I mean, they're going to know their numbers. I don't know their numbers that well and weigh whether it's worth it or not. Representative Matheson.
I think it's really important to put parameters around taxpayer money. I really do. I think that this is I'm not a big fan of a stick. I'm a big fan of a carrot that helps maybe federally qualified healthcare centers that apply for this grant, because we looked at 9 FQHCs that under $4 million, they were able to improve access in all of their facilities. That was our bill was for 3.4 million for nine FQHCs. So I guess I think that this is really important to have some parameters around state money and taxpayer money. That was one of the reasons why I was really excited about this possibility.
Representative Boyer.
Thank you, Madam Chair. I just wanted to throw out there, I think the department, as we're talking about them, said that they felt like this was going to be hard for them to manage. Do we want to think about,
When did they say that?
I think in their testimony to us,
On the original
right?
bill.
Yeah, that they, we're already going to have money from the Rural Health Transformation Grant and that there was time limited. And so I don't know if we want to sort of consider that as part of.
Okay, Representative Clucci.
Thank you, Madam Chair. What if we consider creating a separate grant funding program to provide, so that people can, like, primary care clinics can seek reimbursement for uninsured or underinsured primary care that they're providing? Right? We don't want people showing up in the ER because they don't have insurance, so they're no longer going to go see their doctor. And so then they show up in the ER, and then the hospitals are going to have to pay. Nobody's going to pay for their bills, except the hospital is going to have to pay for it. So what if we create a fund and we try and advertise, if you don't have insurance, you can go get primary care at these places, And then those clinics can apply to have that care reimbursed from this fund. So it's a way of helping those people that have lost their insurance or become underinsured through the loss of the enhanced premium tax credits, and continues to compensate the people that are providing that primary care, but you focus it on the primary care, which is more preventative than the hospital funding.
Further thoughts, discussions, Representative Arford.
Honestly, this bill feels like a ping pong ball to me. We're just bouncing all over the place. I mean, I love the idea of somehow making primary care available to everybody who has lost access to their primary care provider because of their loss of their enhanced premium tax credit, and they dropped off the exchange, and they probably still have the doctor. They're just not going to them because they don't have insurance and they can't afford to pay the bill. So, so if there was a way to fund that, I mean, clearly that would be an advantageous thing. I just can't imagine how we would do that and how we would identify the people that have actually lost. I know that actually the exchange, coverme.gov, has kept amazing information on all the people that did drop off of the exchange, but whether or not it could be used to identify people who are not using their primary care as a result because they can't afford it, I'm not sure how we would do that.
Yeah, and I think, again, part of this bill, there is a part of this bill to address those who lost their insurance due to subsidies, and the whole section on, trying to make up that.
Oh, I thought that's what so we're just talking about anybody who is not accessing primary care because they cannot afford it.
I don't want to.
Yeah, well, I mean, if there's some way we could tie this into making sure everybody can afford primary care services, I think that would be an admirable goal. I just can't imagine right now how we would do that, but I'm sure there's a way if we were able to spend the time and had the resources to figure it out.
Thank you. All right, further discussion? Representative Clucci.
Okay, so there's 4 sections of the bill. First one is about the Rural Health Stabilization Program. And the proposal is that this committee is recommending we add $50 million for DHHS to decide what to do with that money. Then the chairs had suggested sort of a carrot tied to limiting, I think, hospital fees.
Lowering healthcare costs.
Lowering healthcare costs by capping the fee increases. So what I'm proposing is, if we're going to use $50 million, is to try and focus it on primary care. The second piece talks about the Health Premium Stabilization Fund, right? That's the proposal to directly try and make up for the loss of the enhanced premium tax credits. We heard from the department that that's really hard to implement. Number 3, I thought we heard from the department that was about sort of the technology frame changes to be able to comply with some of what's happening at the federal level. I also took from the DHHS testimony that they said they already have money, they're already working on that. And so we might not necessarily need to consider that as part of the bill. And then the last section we talk about is McGarrett. So I would be in favor of moving forward with 4, refocusing number 1, as I've suggested, in some sort of way for people to get reimbursed for delivering primary care to uninsured or underinsured. I don't think that we necessarily need 3. And then on 2, I'm a little bit sort of ambivalent. I mean, it's going to be a ton of money if we're trying to make people whole. I don't know that we would be able to even come close to meeting the need. I think it's a worthy cause. We've also heard that it just would take a while to implement. So I'm willing to continue to discuss, but again, I recommend keeping 4 with Rep. Matheson changes, scrapping 3, considering to think about 2 and changing 1.
Other thoughts? Representative Foley.
So are we suggesting that we're going to get rid of LD 519?
No, I wouldn't. And here's why. And I know, there was a suggestion to maybe change it, but the reason I wouldn't is because you never know what's gonna happen in AFA. And so, I don't know that I would want to get rid of 519 because this may get funded, it may not get funded. 519 may get funded, may not get funded. So I don't, yeah.
Colleen, have we released 519?
Oh, yeah, is it out of committee? It's not. Yeah, and I know, Representative Morris, you had said you might want to change it before it goes out to, go ahead.
Yeah, sorry. Yeah, I would just say I
Continue.
would consider changing it to at least to change at least at this time doing the assessment, the increased dollar per month, but at least giving the Bureau the authority to do that through major substantive rulemaking so that it may be something that that would give people an opportunity to weigh in. I think there was some concern with the way we did it about not allowing some businesses, because I have heard some concerns from businesses about adding another $1 per member per month, right, starting next year. But but I think if we had a way that we could, if that was the direction we wanted to go in, to at least allow them the opportunity to weigh in through the Bureau if the Bureau wanted to ask for that additional $1. And then it could come back to us and we would get to hear them as well. I think that might be the way to do it if we were considering increasing the assessment. I do think that there may be, if we can't get what you have suggested, which I'm not opposed to, which is an ongoing funding through the appropriations process. But I do think there does seem to be consensus about the value of having Megara going forward. So.
And that's, again, why I wouldn't get rid of 519 altogether, because we just don't know if they're going to approve the ongoing funding. So, Representative Foley.
I mean, just my thought on it. I mean, we could take the Megara money out of here, out of this bill, and we could take 519 and do something different with it. And the thing that I was thinking about is 519 has a 1.5% premium credit. That's how we got the 40 million.
Yeah.
So my thought was that, maybe instead of having it here where they're going to be competing, you get you go to 2%, because that'll raise another $15 million. Go back to the $4 per member per month to get rid of that, because that is a problem. That would still give us ongoing money on an annualized basis of about $128 million to go towards Megara. And that's ongoing. That's every year. So my thought is that if we have two things going on, you may not get either. You know what I mean? So I'm just saying, maybe we refine 519 and use that as our vehicle for the funding from Megara.
Again, I just disagree that they're going to necessarily compete with each other. It's just going to give AFA like different options. And they're going to end up funding Megara to the extent they're going to fund Megara, or whatever vehicle they use, or they'll put it in the budget. So I'm not concerned about them competing at all. Representative Mastracchio.
Thank you, Madam Chair. I guess I'm not either, because I figured that's what they're there for. They'll take it, they'll figure it out. If they want to fund it, they're going to fund it one way or the other. I'm just going to say right up front, I'm not really think that we're at this stage of where we're supposed to be in the committee process to do what Representative Clucci wants to do. Nice thought, but you're going to be here next year, so go for it. I think I'm okay with this exactly as it is, and I think I'd like to just move on to pass on LD 2208. Oh, I can make an emotion though,
Yes.
as amended, and I'm willing to listen to any amendments.
Could you just clarify the amendment? Is it the ongoing funding?
Yes.
Okay.
Yes.
Just wanted to hear.
Yep.
it. Okay, thank you.
Would it be reduced? Did you suggest cutting it in half to 40 million
Yep.
ongoing? Is that a motion?
It is.
That is my motion.
I'll second that, but I also wanted to clarify it.
Okay.
Just want to put it out. Great. And did you want any language in there around the per member per month or not?
So here's my concern. I want to get something that we can agree on. So whatever the committee wants, I just think that we need to move this forward. And I'm in general agreement with most everything in here. I think it's important. So whatever will, get the most support, I'm fine with. So I'd like to hear from people. So whatever. I mean, it's,
This is already increased in 519. There would be a conflict to really and maybe wait.
Okay.
Deal with that at 519.
Got it. Got it. Okay. Okay. All right.
So did you second
I did,
Representative Matheson? Okay, so did you get that? Another Representative Matheson seconded it. Okay, thank you. I wasn't clear, so. Representative Arthur.
That's fair.
So is there any plan, I'm directing this question to the chairs, about if we were to pass this bill as is today, the bill and the Health and Human Services was to pass their bill as is in the near future, how we would reconcile these two bills, and they're two similar yet different initiatives that.
Right, they are
across tri-
similar but very different.
Yes.
Again, I don't know, is 2196 going to go to AFA? I haven't paid that close attention, whether it would have
I
a
think it might, but I don't
anticipated
know for
fiscal
sure.
note.
They were working it this afternoon. I do know
Yeah.
that there was some additional amendments that the sponsor suggested, so I don't know what HHS has done. Other people might know. They've already voted it. Yeah, okay. So
They did vote it?
tabled it. Okay.
Tabled it. Okay,
So,
thank you.
but they don't conflict. Like
Right.
they both can go forward. In whatever form. This is a condition of eligibility for grant funding. That would have much broader application and if that bill went into effect, that would affect all hospitals. They would be required to comply if it went into effect as it was originally sort of drafted. Everybody would have to comply after a certain date with these maximum prices. This is just a voluntary condition of eligibility that if a hospital applied for funding through this stabilization fund and they accepted the funding, they would have to meet these benchmarks that are laid out in this as it moves forward. One thing I would say is that I know that the sponsor suggested it in a different amount, like in terms of a different reference point of Medicare rates. And if they do vote something, you may want to make those consistent or maybe not, but they both can move forward.
Representative Matheson.
Which sponsor are you talking about?
The sponsor of LD 2196, yeah.
What was the recommendation?
I think it was a recommendation to move from 200 to 300%, as I understand it.
Thank you.
All right? Yeah.
Representative Arthur.
And it's also, is it correct in the other bill, instead of going after the charges that the hospitals actually charge their patients at 200% of Medicare, their bill actually says that the insurers cannot pay more than 200 or maybe 300% of so when the insurers contract with the hospitals, that contract they cannot agree to pay over the 200%. Is that correct?
No, I believe most of that bill is focused on the hospital, what the hospital can charge. There
Okay.
is some provisions later in that bill that apply to insurers, but the main part A of the bill that speaks to the reference point, and I haven't looked at it in a week or so, is on the hospitals, the obligation is on the hospitals, not on the insurer.
Okay, because if
The
there is,
trusted.
yeah, well, we don't have that in this bill, so.
Right. And again, that bill is more the stick, this is more a carrot.
Right, so the only other thing I want to say is, we do know from the testimony that in terms of the healthcare premium stabilization fund, that it will be quite a lift for the coverme.gov folks to put together a a soft, whatever you want to call it, because it will be completely separate from what the federal government does what they do when they figure out what all the premium subsidies will be for members on the exchange. And they're going to have to come up with their own system, which will be very different. And they're also going to, we're going to try to figure out how we can have the least impact on people's income tax consequences at the federal level. And that they've already said that will cost between $1 and $2 million to put that system together, and it won't be operational till next year. So I think we don't mention anything about that in the bill, and
I think that would be reflected in any fiscal note.
yeah. What is the operationalized date of this when we want these funds to be made available? It'll be in 2027?
There's no specific date or timeline. It would just, as this is drafted, it would take effect if the legislature enacts it 90 days after the legislative session. And then there'd be a requirement. Then the departments would move forward with implementing. But there's no specific timelines or dates for when funding has to start or anything as it's drafted now.
That would be addressed in AFA as well.
So there is one thing we might want to consider with, by the way, I'm fully in favor of trying to do whatever we can on the exchange to help people who have lost a part, if not all, of their premium subsidy. However, there is the possibility that the federal government will come back in 2027 and go back to fully funding the premiums on the exchange, including the enhanced premium tax credits, in which case we would not need that part of the bill. It would be duplicative. So might we want to say something in here that if in fact the federal government initiates, when and if they reinitiate their program, that we're talking, this whole thing is about replacing that program to whatever extent we can, then this program would just be discontinued. Because if we don't do that, we'll be operating a program and they will be operating a program, and we don't know what the consequences of that would be. Colleen, you've done that before. Isn't it a very easy thing to do? You just say something like, the federal government at the point which blah, 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 blah.
Well, yes, but this is going to appropriate funds, and assuming this appropriates funds into the program, into the fund, and it is, as it's drafted, a non-lapsing fund, dedicated non-lapsing fund, it would require future legislative action if the money is unspent to move it somewhere else.
No, but what I'm talking about is they're also going to have to come up with a quite elaborate
Yes.
technology,
Yes.
software, whatever you want to call it,
Yes.
to run this program out of the exchange. They
Yes.
can't just take our money and kick it into what they have now, because that's a federal, we can't use that. They gave testimony about this and explained it, the department did. So at that point, do we cease using that technology? Do we cease using that and go back to using the federal?
I would
Technology?
think that's what they would do. They would no longer need it. And if then there would be some further legislative action needed. If they was unspent funds, the legislature would take action to appropriate the funding elsewhere. But it would require additional legislative action. There's nothing that would prohibit the department from ending the program in the event that federal funding was available, as this is drafted.
I think it would make sense to put a clause in here that simply said, the intent of this program is to replace the federal program. We're not trying to stop.
It says.
Yeah,
that.
okay. And and just to say that when and if the federal program's in place again, this will cease to be. I don't know, the funding would could we say the funding would roll over into the funding? I don't know how we'd say that, but that we wouldn't lose the funding that had been allocated if there was anything left over at that point in time that would still be able to be used for the exchange. Clearly,
I think you could do that. I mean, I don't know, it may make sense to see what the fiscal implications are first before making a decision like that about whether or not you want to change any of the parameters of the program, because we haven't had a complete fiscal review of what this would be. So that might be something you could defer. And you could do that at language review,
Right,
perhaps.
get
I
our
just don't know
fiscal,
enough
yeah.
about it. Once you see
Yeah.
the fiscal note, once you see if they, how much, if they do need additional resources, what they are and.
Yeah.
And if it does implicate technology or software and that sort of thing, that would all be laid out in a fiscal review.
Representative Mastracchio, did you? have something?
Thank you, Madam Chair. That's what I was going to say, that the fiscal note will reflect all those implementation things. We don't need to, in my mind, figure out every little detail. That's the whole point. Do we need a caucus or does anybody need to caucuses? Okay, well, that's why I'm asking, because we could sit here and not caucus and then we're just, I mean, the motion was, well, you can.
What I think the motion is the screen sheet. And the only change is if you look at section 4 of the legislation in the appropriation section, top of page 5, where the first appropriation of $80 million to Magera, one-time funding of 80 million, that would be changed to $40 million annually on an ongoing basis. That's the only change.
Representative Matheson.
Thank you. I was just curious if we've ever put any language in a grant situation where if the money wasn't used for that grant, that it would relapse back into the general fund?
That's here.
Is it in
Well,
there?
it-
Did I miss it? I'm sorry if I did.
I think it's non-lapsing, right?
Yeah.
Which means it doesn't go back into the
Right,
general fund
it
unless the legislature makes a change.
Right.
You could make it lapsing and then it would, but right now, the way this is drafted, it's non-lapsing, which means
Okay.
it will stay in the fund until the legislature does something to
Until
move
they
it.
decide. Okay, great.
Well, if it's
That's how
appropriated.
That's how I didn't understand
Yeah.
that. Thank you.
Okay. Any further clarification before we do a cone of caucus? Okay. Let's break for 10 minutes, hopefully, or less. All right, welcome back. And we've had corner caucuses. There is a pending motion. Do we have further discussion? All right, seeing none, then I guess Representative Arford.
I just wanted to say that I would, and I've already spoken, I know with some people about this, and I know it's not the will of the committee, but I just do want to make the point that I would like to see more money going into the healthcare premium stabilization fund, because my understanding is that it's well over $100 million that it would take to replace the funds that we lost in 2026. So I will continue to work on that, but I just wanted to go on mic and make that comment that I think we do need significantly more funding for that initiative in the bill.
Okay. Further discussion. All right, Edna, I think we're ready.
Thank you. Senator Bailey?
Yes.
Senator Bailey, yes. Representative Matheson?
Yes.
Representative Matheson, yes. Representative Alford?
Yes.
Representative Alford, yes. Representative Boyer?
Yes.
Representative Boyer, yes. Representative Shamino?
No.
Representative Shamino, no. Representative Clucci?
Yes.
Representative Clucci, yes. Representative Flynn?
No.
Representative Flynn, no. Representative Foley?
No.
Representative Foley, no. Representative Mastracchio?
Yes.
Representative Mastracchio, yes. Representative Morris?
No.
Representative Morris, no. Representative Olson?
No.
Representative Olson, no. 6 members of the committee having voted in the affirmative and 5 in the negative, being,
Minority report is
If you could do it on mic, please. Thank you.
Minority report is the ongoing funding of 40 million for Megara and for the premium stabilization fund.
Just those 2 sections.
Yes.
Okay.
All right, thank you. That will close the work session on LD 2208.
Thank you.
And then I think the only other, maybe 1 or 2 things.
Yep.
One definitely is Representative Arford has asked to reconsider her vote on LD 2151. So I would ask first for a motion from anyone other than Representative Arford. 2150.
FQHCs, and I just want to say, this is the fiscal note, which just
Oh,
shows,
okay.
just so people know, I did get it right before we started today. So I think
Okay.
it's out. And it just confirms that only the appropriation is needed, which I think was the expectation.
And I think the report on that was Representative Arford, the only one.
The fiscal note for both items are the same. So this is the fiscal note actually that I'm handing out is for the majority
I just wanted
report.
to confirm who could make the motion.
Oh,
who was
yes.
On the prevailing side.
Only one, yeah, only one, only one on the minority. So anybody else can.
Okay.
Yes.
So just to start with, if
Yep.
someone would make a motion to reconsider LD 2151, Representative Foley.
Make a motion, we reconsider LD 2151.
Okay, thank you. A seconded by Representative Matheson. So we're now back in work session on LD 2151. Looks like we did just get the fiscal note and Representative Arford. Did you want to say anything?
Yeah, thank you, Madam. No, I just would like to say that upon further reflection, I have determined that I could be of best service to the people of Maine by voting with the majority of my committee members. And so I would like to change my vote to vote with the majority.
Okay, thank you. So we need a new motion to pass as amended.
Did you vote on the reconsider? Did you raise hands?
Oh, we didn't.
Okay, so
Sorry.
that would be good just to see that
Yes.
everybody's agreeing on that first.
Thank
Yeah,
you, Colleen.
okay.
It's getting late. I'm
No, I
getting
know.
tired,
So we're
thank
good.
you.
And now somebody can make a motion.
Okay. So I don't remember who made the original motion, but we'd need a motion to pass as amended. Yeah, Representative Foley.
I make a motion to pass as amended to LD 2151.
Seconded by Representative Matheson. Any discussion?
And you're just removing majority report.
Okay.
Removing.
Removing.
Yeah.
Moving it
No-
again.
Not removing, but removing.
Senator Bailey?
Yes.
Senator Bailey, yes. Representative Matheson?
Yes.
Representative Matheson, yes. Representative Alford?
Yes.
Representative Alford, yes. Representative Boyer?
Yes.
Representative Boyer, yes. Representative Shamino?
Yes.
Representative Shamino, yes. Representative Clucci?
Yes.
Representative Clucci, yes. Representative Flynn?
Yes.
Representative Flynn, yes. Representative Foley?
Yes.
Representative Foley, yes. Representative Mastracchio.
Yes.
Representative Mastracchio, yes. Representative Morse.
Yeah.
Representative Morse, yes. Representative Olson.
Yes.
Representative Olson, yes. 11 members of the committee having voted in the affirmative and 0 in the negative.
All right, thank you. That'll close the work session on LD 2151. The only other thing, Representative Morris, did you want to reconsider 519 today, or are you ready to do that, or, I mean?
Certainly can. That's if it's what people are amenable to.
I think so. I think so.
Yeah.
Hold on, well, move it. I have some technical maybe concerns, but that's all.
Okay. Okay, well, we can,
I could.
you can address those. But yeah.
I will move that we reconsider our actions on LD 519.
Okay, is there a second? Second by Representative Matheson. All those in favor? I remembered this time. All right. So we'll open a work session on LD 519 and Representative Morris, if you wanted to explain what you wanted to change.
Yes, I think if we can change it to take out the assessment right now and change it to to major substantive rulemaking, giving the Bureau the authority to recommend increasing the assessment, but major substantive rulemaking going forward. So beginning, I guess would be in 2028 would be the year they could start if they wanted. So it wouldn't affect the next plan year. But starting in 2028, potentially they could make a recommendation if we didn't get the what we did in some form in the other bill. I think, sorry, if I'm explaining it well. So keep what Representative Foley suggested of the second piece of it, and then potentially for the Bureau to be able to make a rule, a major substantive, so they have to come back to us if they felt that there was a need for an increased assessment.
So that's where the technical problems come in, because the Bureau,
Okay.
I think, and I'd have to look at it
Yeah.
again, but I don't think the Bureau has any rulemaking authority with regard to Magara, because Magara is a
Oh.
private entity. So
Oh.
I think what we could do is, require put some unallocated language in
Yeah.
519 to ask the Bureau to come back to the legislature next session with a recommendation as to whether or not the assessment should be increased.
We could do that.
Is that what
Yeah.
and then the committee could report, then you could report out legislation to increase the assessment to take place in time for the 2028 plan year.
Or in future years,
Or-
yeah,
or
if they,
any-
if they
yeah.
want it, yeah, I guess we could do, and then keep doing something like that, giving if they wanted to make a report even.
So
on-
if there's an ongoing basis, I think maybe I could build in like an ongoing report to
Yeah,
do it, but.
yeah. An
Yeah,
annual
or even if
report.
maybe it's Magara who comes to you. Anyway.
Yeah, I
let
mean,
me
I
think about it
actually,
as
I
to
think
how
that
works, but-
either that or an ongoing report from Magara
Yeah.
about not just potential assessment, but also structural
Yeah,
changes as well,
you
I
do
think.
they do have an annual reporting requirement,
Right.
Magara, but you could expand that to include a recommendation related to the funding of the assessment.
Funding
With
and-
authority to report out legislation
Right.
in response.
Yep.
So that might be more the approach as opposed to
Yeah,
requiring a major substantive. rule
right,
to
yeah,
be
that might be
adopted.
the one.
Okay.
Yep, so I
If
think
you're
sort
okay
of.
with me figuring out.
Yes, I think,
that,
yeah,
then
something,
I get your
something
intent.
along the lines of, yeah, both assessment as well as also structural recommendations for the program as well.
Okay.
I think would be appropriate.
So can you repeat what we're doing?
What I'm moving?
Yes, I don't know. I'm not sure exactly what we're doing. Because I'm looking at the.
Do you have the
The
amendment in
amend- I
front
have
of
the
you?
amendment
Oh,
in
okay,
front of
so
me.
if
Yeah.
you're looking at that, so that's helpful. I was gonna say, I don't know if anybody even had that, their folder out yet, but you would take out section 1, which is the increase of the assessment to $5 per member per month.
Okay.
Section 2 would stay the same, and then in place of section 1, you would be amending the amendment to put some unallocated language, or maybe allocated, I'd have to figure it out, but for a report back to the legislature on an annual basis about the current assessment in statute, whether or not that needs to be increased. Also allow Magera to make suggestions about structural changes to the program. And then as part of that, give the legislature the authority to report out legislation.
Okay.
I would just like to add that they would report not just if it should be increased, but if it should be
Yes,
decreased
decreased.
or
Yeah,
eliminated.
or changed.
Yep.
Yeah,
I agree.
you could
Fair
do
enough.
that. They already have statutory authority to do an emergency assessment up to $6 per member per month. That wouldn't change. But
Yeah.
this would just be the ongoing,
Yeah.
the $4 PM. Think
Works for me.
that's, and so there's how to work it out is what I haven't had a chance to take a look at. So I think I could do it in allocate the language on an ongoing basis to allow them to do it. And I think the appropriate avenue is for Magera to do it. They have, and you can look at it and you'll see it again, obviously.
Yep. All right. So Representative Morris, is that a motion?
Yes, that is a motion.
Thank you. Is there a second?
Didn't
Second
get
by
you.
Representative Tomino. Further discussion, Representative Matheson.
Thank you. I just wanted to ask Colleen, how does that affect subsection 2, the transfer of funding?
So it wouldn't.
Okay.
I don't think there's any intention that it would affect section 2 of the amendment. That would stay the same. So
Okay.
on an starting next year and annually thereafter, the superintendent would be required to calculate the amount that would be equivalent to that 1.5% assessment.
Okay.
Let the state control it and then have the money be transferred from the general fund. So that would all stay the same.
Okay, great. Thank you.
Further discussion, question. All right, I think we're ready, Edna.
Senator Bailey.
Yes.
Senator Bailey, yes. Representative Matheson.
Yes.
Representative Matheson, yes. Representative Alford.
Yeah.
Representative Alford, yes. Representative Boyer.
Yes.
Representative Boyer, yes. Representative Shamino.
Yes.
Representative Shamino, yes. Representative Clucci.
Yes.
Representative Clucci, yes. Representative Flynn.
Yes.
Representative Flynn, yes. Representative Foley.
Yes.
Representative Foley, yes. Representative Mastracchio.
Yes.
Representative Mastracchio, yes. Representative Morris.
Yes.
Representative Morris, yes. Representative Olson.
Yes.
Representative Olson, yes. 11 members of the committee have voted in the affirmative and 0 in the negative.
Right, thank you. That'll close the work session on LD 519. We do not know our schedule yet for next week. We have 2 more bills we anticipate coming. Oh, you got some more.
I just have one language.
One language review. I can still talk while you're passing those out. Just, so we don't know when we're going to meet. Certainly it will be on a day we're in session. It'll be an afternoon, but we've got the board merger bill that hopefully will get referred on Tuesday. And then we're waiting for major substantive rules on the naturopaths. So those are the 2 that we anticipate coming, and we'll have to schedule for a public hearing. And then, of course, language reviews and yeah. So we're definitely getting near the end. All right.
So I did have this one quick language review. This was LD 2129. The fiscal has been completed. You've already seen this language. This is the revisor's office final language. 2129 is the bill related to medical debt and garnishment and wage garnishment. So this is the change, the technical change, and then the second change about the accumulation of interest and not having that be permitted for those liens that would be in effect prior to the effective date of this legislation. I just wanted you to see the fiscal on the back, which is minor cost decreases, minor revenue decreases to the general fund. Because they are minor, my understanding is those are not subject to referral to the special appropriations table if this moves forward, just to give you a heads up on that. And then I also would note that based on what the committee decided yesterday or the couple of days ago, for any additional amendments that come through that have no fiscal impact, you are comfortable just doing those reviews electronically. I did just get, right before we started, I got the fiscal note back on LD 2133, which was the EMS bill dealing with community paramedicine. That has no fiscal impact, so I will email that to you. You saw the language of that yesterday or the day before. So that one will get hopefully reported out and appearing on your calendar on Tuesday. So things are starting to move on those amendments that you previously reviewed, and we were just waiting for fiscal. So just to give you a heads up, and if there are any additional that are just straight no fiscal impact, I will email them. The others, since we're going to be meeting next week, we'll have an opportunity. We'll do an in-person language review for those.
Were we done with 2201? Were we still working
We're
that?
s-
I think, yeah, we're going to be looking at language still. Yeah. Yeah, that's definitely one
There's an
we won't
amendment.
do by email.
No.
Yeah, yeah. Anything else?
There's an amendment from you, right?
Yes.
Yeah.
Yeah. Okay. All right.
Great.
Good job, everyone. Thank you. We'll see you next week.
Thank you all.